The Ways and Means Committee of the Board of Aldermen is now called to order. Mr. Clerk, would you please call the roll?
Alderwoman Cruzen. Alderwoman Florida. Present. Alderwoman Behringer. Vice Chairman Williamson.
Here.
Alderman Moore. Alderman French. Alderman Vaccaro.
Present.
Alderman Carter.
Present.
Chairman Kennedy.
Here.
Alderwoman Cruzen. 6 present. We have a quorum.
Thank you. We're continuing the review of the budget and our interviews with various departments. Today we have from the Department of Health and Hospitals as well as the Police Department. So let's, Pam Walker or you? Who shall come? Let's take, come forward. Why don't you come first? Mm-hmm. First we have us before Pam Walker.
Yeah. Hi, good morning. Commissioner Moore has a really detailed report of some of our most current challenges, so I'm going to be really brief and let her do that.
Okay.
You know, the Department of Health is one of the most challenging agencies to run, with the broadest issues of any agency to deal with, and all of our managers are expected to be experts in everything, from people who can't get their Medicaid coverage to somebody who said they have a water moccasin in their tree, over the weekend. So I don't know any of our managers that aren't working 50 hours a week at least. So we spend a lot of time on training, quality improvement, keeping people's skills up and becoming and having a learning environment. And part of that has been our comprehensive strategic plan. Another part of it is in June, we're going to apply for national accreditation. Only about 20 health agencies nationwide have been accredited nationally, and that will be about a year-long process to get that through. And then the only other thing I want to mention is we enrolled with our partners about 100,000 people in the region for health coverage, either through the Affordable Care Act, our Gateway to Better Health. 28,000 of those people are in Gateway Better Health, which is the Medicaid gap created by the legislature not passing Medicaid expansion. And if they don't do that in the next 2 years, those 28,000 people are going to lose coverage. And that group of people also don't have hospitalization. They just have urgent care, specialty care, and medications. And primary care. So I feel like that's sort of a train coming toward our department. I just want to put that on your radar. But Commissioner Moore's really prepared a detailed report on our budget and what we're doing and what we asked for. That's okay?
Let's bring her up at this point. Good morning.
Good morning. Good morning, Mr. Chairman and other members of the board. Let me begin by saying I am always honored to come before you to share with you successes. This year, for our budget, we really, truly, as always, focus on the core functions of public health, which are assurance, assessment, and policy development. Everything we touched this year was centered around that, and those are our core practices. To elaborate further, allow me to translate our purpose into actionable items for this year. Prevention of epidemics and the spread of disease. The prevention and further spread of Shigella and pertussis infection among school-aged children and adolescents is being monitored through our surveillance unit. We were able to detect an uptick in Shigella cases this year. We immediately spun into action by standing up our incident command structure to manage our team's responses, of consulting with our medical and daycare providers, public and private educators on the few steps to eliminate the spread of infection. When we received a report, there were 2 cases of pertussis in the schools. Likewise, we immediately made certain those children were excluded from school and began our investigation and educational outreach to those children and their parents. Shigella is an acute bacterial disease involving the small intestine and colon, characterized by loose stools. A small volume occupied by fever, nausea, and sometimes vomiting and cramps. We see this a lot in daycare settings, and good old-fashioned public health is hand washing, 20 seconds. You can sing the happy birthday song or say your ABCs. That's the length of time. Next, it was preventing injuries. Preventing injuries while serving on the fetal fatality review team. Our director serves there. The data was glaring on the number of unintentional incidents. We continue to gather and analyze the data on the injuries reported on our children. We reached to subject matter experts on child abuse to prepare our staff for their role as mandatory reporters of child abuse. We put plans in place to restructure the grant request for maternal, child, and family health to focus on injury prevention. Again, what did we assess? We assessed the data. What did the data tell us? That's where our focus needed to be. The data gathered covers dates through 2013 to April 22nd, 2014. And I'm not going to go into all the details, but if you want a copy of this, I'm more than happy to share that with you. Youth violence. Again, this led to a broader, more intensive look into the role of public health as related to youth violence. Our director has developed a white paper, which is a living document that our department is beginning to work and carry through for the next fiscal year. And that will also be made available to you if you choose. And I'm just going to give you a couple of things that we're looking at. And we're in partnership, always thinking about who else is doing what we see, because we know we can't do it alone. We're out of the silos. It's about collaboration. So we know that the Mayor's Commission on Children, Youth, is specific. They're looking at children, they're looking at youth, and they're looking at the family. So what's the role of public health? To establish plans for making progress on the St. Louis Regional Task Force Youth Violence, track children and teen deaths on a monthly basis, and share the data with appropriate agencies. Serve on the Child Mortality Review Panel. Assure that existing DOH programs incorporate violence prevention. So that's every program within our department. We want to make sure there is a component that's looking at violence prevention. Develop an appropriate violence prevention public health campaign. It is going to need a campaign, and we need advocates. Outline details for integrating the Youth Violence Partnership plan in the overall project. Evaluate the progress. Create an asset map. Create a network analysis to identify connections. Meet with potential project managers. Identify a champion or champions to carry forward what we see and what others see in collaboration. Initiate the development of a community safety scorecard and seek funding to carry out opportunities to meet these goals. And families, which outlines the role and responsibilities of public health. In yet another area, it was promote and encourage healthy behaviors. In October, we launched Jump Into Shape, a program for every age group and demographic targeted at reducing obesity by 5%. It's a collaborative with partnering agencies. You can log on to the website and register to track and set your goals and track your level of activity. So far, we have 200 plus registered participants. So hear that word again, assure quality and accessible services. We assured quality and accessible services by responding to the changing environment of healthcare services with the closing of St. Louis Connect Care. It was a sad day for us, but I have to say, our department and our partners stood up, and in less than 10 days, we had the programs, 2 categorical services programs in place. I couldn't have done that without the support of this body, without the support of our leadership in the mayor's office, and the support of our community partners. It was truly an opportunity. If we had been taking snapshots of what was going on starting in October, and it was October the 28th, and I think Alderman Williamson was at that meeting, it was alarming. But we were able to, I always like talking about a ship. We were able to turn that ship and guide it in the right area because we knew that 80% of our STD patients and clients were being seen in private provider offices. So we knew there was about 20% that was actually accessing services through St. Louis Connect Care. So what we simply did is we convened a meeting and brought all our partners to the table. And as you know, it was Downtown Urgent Care, it was another provider, and then it was the Spot, because we knew young people between the ages of 13 and 24. That's that age group that we know that is in risk and at risk for STDs. So as I said, we convened a meeting, we developed a plan. We identified and established transportation, because what I wanted to assure was that any patient that needed to be seen in our TB clinic had access to the services. We established contracts, we bought equipment, we had to, that was my first experience with ordering a portable x-ray. Never did it in my life. Never really had to order medications, because when you're already in a contained health system, they do that for you. So I had my experience, and thank you for that. It was kind of shaky for the minute, but I made it. We identified a partner to open up our TB clinic, and I am proud to say that my staff worked very hard with me and the director's leadership team, and we are going to officially open our tuberculosis clinic on May 26th of 2014. So any patient who is needing to receive a chest x-ray can come into our facility and receive that. So I'm just going to go through just a little bit of the individual section accomplishments with communicable disease. So here's what we know about STIs. It's a younger population, and we know we have to reach them where they are through social media. It's education. Through our assessment, we also recognize that what our strengths are. You know, when you're in management, you always look to the strengths of your team. You don't look at their weaknesses, because you look at the strengths, and then you match them with their strengths so that they can do a better job. Then you pair them up with someone who has their strength as their weakness. That forms that team, and you're able to get things done. So we know that gonorrhea decreased about 2.6%, and that's a slight decrease. If I was a statistician, I would say I am certain, but I'm not certain if that is statistically significant, although it is a 2.6% decrease. I'll take my decrease any way I can get it. Hepatitis C decreased 62.4%, and that's a calendar year. Salmonella cases decreased by 5%. Pertussis cases decreased by 59%, and you know that that's that bacterial infection respiratory. I did share with you, we trained our staff on operating our x-ray equipment, developed policies and procedures. Another hallmark, but something that I think it needs to be mentioned, and I would be remiss if I didn't. In about the first 30 years, we had this year our first MDR case, multiple drug-resistant TB case patient, and we were successfully able to assess, get his contacts tested, and also reach to a community that we had not already been into, the Vietnamese community, and they worked with us in setting up testing sites for our staff to go in. It was a learning experience for all of us, as well as with our state partner, and we were able to have that gentleman moved to a treatment facility in South Carolina. And I also want to show my appreciation and thanks to the St. Louis Police Department, because they were instrumental in assisting us too. Grants administration. Early detection services under the Minorities AIDS Initiative, funding improved from a positive rate of 0.4% in 2011 to 1.4% in 12, due in part to the increased efforts of the staff at each of the subcontracted agencies. And I also want to say, I believe, because of the efforts that we have partnered with our legislative delegation in supporting us, as well as this leadership body, in stressing the need for really focusing dollars where the greatest need is. Women, children, and adolescents. As many of you heard on the Health and Human Services Committee, we were successful in securing funding through the National Institutes of Health for an early childhood well-being program through the Morehouse School of Medicine. And this is where we're going to have parent mentors and parent leaders that we will hire in partnership with Washington U's Project Launch. They will also supplement a portion of the salary for our parent mentors so that we can implement our parent mentoring program. Again, our focus is around obesity. Health services increased children's immunization compliance in private, parochial, and charter schools. We served approximately 78% to 98% compliance. Show Me Healthy Women. Last year, we did an assessment of the Show Me Healthy Women, and I kept thinking that there were some gaps. The state kept saying, no, you're doing really fine, you're really successful with this, but I kept looking at the data that was coming out that the Regional Health Commission put out, that we were seeing more minority women that were being diagnosed at a later stage for breast cancer. So then I took a look at our data, and what we were finding is there's a high percentage rate of women who get tested first, they go through their diagnostic, but they don't come back when they have an abnormal. So the plan was to reach out to Washington University because we knew that they had a grant. And we asked for some help through Dr. Heidi Miller. Dr. Miller came in, she worked with us, we kind of talked through, well, what do you think the issues are? And our focus was, how do we increase women's compliance to get them back in? And we felt it's through the messaging. We have to be able to reach women where they are to convince them, because there are things that happen when you hear breast cancer.
Right.
It's the fear element, whether it's fear of the diagnosis, fear of the financial, fear of the surgery, is fear of hair loss. So we convened a meeting with several survivors and the breast navigators. We had that meeting this past fall, and it was very enlightening to hear the messages from these women and the strength that they shared. Because of that partnership, we have been invited with Washington University to apply for a grant to the Missouri Foundation for Health to expand that initiative to develop the precise messaging. So from our focus group with those survivors, we're going to take a look at those messages and put it in a format that we feel will best drive women into our services to be diagnosed after they've received an abnormal. And then to encourage women who have a normal to come back annually and get that breast exam. I know you've been all waiting to hear about animal care and control, so I won't belabor the point any longer. Dog bites. 2011, we had 384. 2012, 408. 2013, 315. 2014, 127 to date. 100 ordinance violations were issued per year. We had 103 ordinance violations in 2013. Messaging to the community, responsible pet ownership. Between 2009 and 2013, our partnership with Stray Rescue has increased stray dog intake by 68%, adoptions by 77%, and decreased euthanasias by 70%. Our Clark Street euthanasia rate is at 38.2%, and adoptions are at 27.7% of intake. Combined euthanasia is at 6.9, and adoptions, are at 60.6% of our intake rate. Now, when you take a look at what we had at Gasconade, we had 1,424 cats, of which 1,054 were euthanized primarily as feral cats in 2013. Animal House, 10th Life, and Stray Rescue had combined estimated intake of over 600 cats. TNR, another group that we partnered with, reported a total of 908 cats that have been spayed and neutered. That's the best process that you can put in place to spay and neuter. And we did that through some funds in 2012, which has resulted in the prevention of over 5,000 unwanted feral kittens, assuming half were females, that had 2 litters of 6 kittens each. In closing, I wish to thank the mayor of our city, this body, for your continued support, trust in me to lead the Department of Health in providing services to the citizens of this great city. I look forward to carrying out my budget that you have graciously provided me. Thank you.
Are those, you said those are statistics that you can get to us?
Yes.
That information? Okay.
Yes.
Let's take up questions from members of the committee. Alderwoman Cruzen.
Yes, thanks, Melba. Appreciate the overview there. It looks like the Health Department budget is, the grants, I should say, portion of the budget is up a little over $1 million this year, which for next year, from 13 million to 14 million, roughly. And that, of course, is good. I was going to use the term free money, but there's no such thing as that, of course, but, you know, getting our share or getting a little more of our share. And is that, what, is that a result of just good applications, or somebody new doing that, or more available, or
Well,
how do we keep that going?
church and state is separate, but I would tell you to pray.
Okay.
The budget increase, we saw an increase in our Ryan White funds of about, I want to say about 500,000. The initial funding that we received through the National Institutes of Health, a couple of things. It's being smarter in where we look for funds. I think our strategy in going outside normal sources has helped significantly, and partnering with other partnering agency has helped. But the Ryan White, I truly believe with the efforts of what we've shown in our grant application, what we've shown in our legislative delegation assisting with us with that, was significant in us getting an increase.
Okay. Under the communicable disease control budget, that budget is up, and professional services are up. Is there, there were 8.7 million in professional services in the budget for 2014, and there's 10 million. And is that services through other hospitals or clinics or that kind of thing?
Right, it's through the funding that we had to put together for our STIs, through the SPOT, through
Okay.
downtown urgent care.
All right. All goes into that line item?
Mhm.
Okay. No further questions. Thank you.
Okay. Alderwoman Florida.
Thanks, Melba. This is the only, I was thinking along the lines of Alderwoman Cruzen that you guys have done a stellar job in going after grant and other funds. It looks like your total budget is $27,279,000, and that last year it was 25. So, I mean, I just think that you guys have been very resourceful and thinking outside of the normal ways that you get funding is really improving your
It is
ability to serve.
improving. My concern is, you know, the grants that we have through the state. You're going to see an uptick, and then it's going to level down, because the funding that we get through the state sometimes comes as a pass-through through the CDC, and then the state will fund their projects. It looks like we're going to get flat funding on maternal child health, which I had hoped we had gotten an increase in so that we can continue our efforts on the early childhood well-being. But we'll make adjustments. So I think there's going to be some fluctuation as, you know, through this next year. But I'm happy with what I have.
That completes you. Alderwoman Behringer.
I just have one quick question. How is the lack of Medicare expansion going to impact your budget?
Well, the lack of Medicaid expansion means that, you know, our $5 million, we have to continue to support that as a match so that we can get the gateway to better help to maintain that $25 million that we draw in for that. I think as we move forward, the other thing that we'll see is more people needing to receive the services. I believe where we'll see that uptick will be within that population that we have been seeing as it relates to STDs. I think New Americans, there's a shift in even one of our grants with our refugee health program. We haven't received guidance yet if we're going to receive that funding where we normally get it for screening. I think there will be a shift there. It's critical times for us. I really had high hopes that Medicaid expansion would pass. I think we've done a great job through our partnerships with trying to get people enrolled. I think the other role for us is to continue to push for education, to get more people enrolled and signed up and understand the importance of that.
Great. Thank you.
Thank you.
Alderman Williamson.
Thank you. I'd just like to really commend you and Pam and your staff. It's been a difficult road, you know, with the transition of Connect Care being closed with the urgent care. And I think your staff and yourself and Pam have done an excellent job. And for whatever reason, I still don't understand why the state legislature decided to opt out of the Affordable Health Care Act. And in saying that, where do you think, and I guess you kind of answered that question a little earlier, where do you think you really need the help when it comes to your grants? And I guess you're having a difficult time at times with the $5 million and dealing with the other grants that you receive. Where do you really see the shortfall at, and what's been very difficult to really, you know, assist the people in the community in the city of St. Louis because of the lack of funding?
I'm gonna give you something that happened this year that really bothered me, and I'm not being critical. Is I always say when people don't know, they don't know what they don't know.
Right.
So this year, with our state partner, and this is one of the things that I see, the funding comes through the state. They write for the grant. They don't reach to the locals to ask for input. What are the needs within your community? So they go after this money. They went after some money. And at the time, one of our managers said, okay, we can do it. But there was no forethought in that and our ability to scale up, scale down. So we met, talked through it with the state, and then they were on board. We told them what we needed to do in order to scale up to deliver these deliverables. I was on my way to a conference, and I had said to the staff, make sure you keep them in the loop of where we are in this process so that they would know that we were going to be on target. And the comment came, there was a message that came back that we could only spend 49% of the contract. We could only outsource 49% of the contract. So I went back in my notes, I went back in the grant and couldn't find it, started panicking, and then my staff person that was in that meeting with the state said, that's not true, Commissioner. That was never said. So then I got on the telephone and I talked to the person. Now we're already in the throes of putting an RFP out to get responses back. And he said, well, yeah, but we're gonna, and I said, well, where's this language in the contract? Oh, well, it's not in there. So I said, okay. So I had a conversation with the director, and I said, you know, this is a challenge for us. And we're in a pickle right now. How do we do it? She said, don't worry, let's see what we get back. Well, based on the deliverables that we had set up in the RFP, the grant respondents came in at about $89,000, $90,000. But now the state had us held to, we could only contract out 40 some, about $50,000. Well, the quality of the product would not been sufficient. And in good consciousness, we could not put our name on just putting something together for that amount of money. And again, I think when you have a shift in staff, that don't understand that you need to reach to the locals. So it's that kind of thing that happens. And everybody's going to save their staff, and I understand that. And that's a challenge, that when you get a pass-through through a state agency, that they're going to look at their FTEs first. So that's why it's important for us, and that's why we've been more aggressive in looking at foundations, Coca-Cola Foundation for Jump Into Shape, the Satcher Institute, and all, when you go to those trainings, you develop those partnerships, and that networking really pays off in an instance like this.
Child neglect and abuse, do you see an increase of that?
Yes.
Yeah, and what do you think? I guess it's probably a million reasons why. What have you done, or what is your staff doing to really try to help out when it comes to child support? And do you get much assistance from the police department, any other, agencies to really abate that problem? Because I've kind of noticed it seems like you're having more child neglect and support now, and I guess, because of the state that we're living in financially, with lack of jobs and everything. So what have you noticed, and what are you doing, your staff, to try to really help, abate that problem and to bring it down to a minimum?
Accidental deaths, what we see, is simple. It's not to minimize it, but it's parents putting children in the bed with them to sleep. And the message is, put the baby in its bed. That's the message. Our director works closely with the police department, and Rose Parsa, I think is her name, in the ME's office, and they both sit on that fatality review board. We also have a seat at the Maternal Child Family Health Coalition. Messaging for us is important. That goes back to injury prevention, those messages that we need to deliver to where people are, to talk about, don't put the baby in the bed with you. There are a sundry of reasons why so few cases have been really followed up on, why you have a mom that has several children, one who has already passed, and then there's another incident that I think is beyond our control, but I think our role in that is to continue to sit at the table as public health and to advocate for the things that need to happen, and then to hold one of us and all of us accountable.
Do you think there's any grants available that the police department or the health division can apply to get some type of financial assistance to help with, the neglect and, child
I don't know of
abuse?
any now, but I know that we're looking at that.
Okay. Very good. Well, thank you. And
Thank you.
continue. Appreciate your hard work.
Thank you.
Alderman Moore.
First of all, I'd like to congratulate you and your staff
Thank you.
on responding to an irate alderman like myself. We have and have been having a dog epidemic in the community. You guys have been working on that. I want to let you know that the non-responsible owners of these dogs with these pit bulls do not understand that these are not the animals that you just put in the backyard and he break loose and run through the neighborhood. They're still busy right now, and we're asking you to come back like you did last year and help us out with this problem. There's a new disease that's out. I think it attacks the respiratory system.
Middle East respiratory syndrome.
And then polio is back. Do we have an action plan if we had an epidemic of this type of, if it attacked us? Are we partnering with the hospitals and all? Do we have an action plan for this type of?
Yes, we do. In our emergency response plans, we use the similar format that we would use if we had a SARS attack or an anthrax attack. We would stand up with our partnering agency through our incident command structure. The hospitals are a part of that. We work closely with SEMA on that. We have, what I didn't announce, and I should have, and I'm sorry, we have a new bureau chief in communicable disease who is a epidemiologist who has worked at the World Health Organization. We just received 9 things you need to know regarding MERS. If you remember MRSA a few years ago, we worked with Mr. Demetrius Johnson in putting the plan together through COVIDian. We met last week briefly, and we're going to have another meeting to stand up that team so they can be incorporated in what we do. So yes, we're watching it. We have surveillance that we conduct daily. And we're in
Okay.
contact with those hospitals too.
Are we equipped to do a thorough exam of women, especially their breasts? Are we equipped to do that? Do we do that, or do we do referrals?
We do referrals through our Show Me Healthy Women program. We reach out. We're the educational component. We go out, we identify women through our partner agencies, and we get them into a system of care. When we get them in, and they have that first diagnostic, and then they tell them that in a couple of weeks, you'll get another report back, and we need you to respond. It's right at that point where women are delaying and not coming in, and the numbers, not alarm, I don't want to be an alarmist, it's less than 10 a month that we're seeing that are not responding. And that number is significant for me. Any number is significant. And we want to make sure those women get back in. And we're dealing with the psychosocial factors too, that I shared with you, just the fear. And then women have shared things about, the stigma of maybe losing a breast, if they have a significant other and their thoughts and beliefs about that. So you have to deal with the whole issue.
So what advertisement campaign or method are we using to get the word out about any of our health issues? Besides, are we using the radio, the newspaper, being proactive in our actions for this community?
Yes. When we stood up, when we had that uptick in our pertussis case, our Shigella cases, we sent out a health alert network to all of our providers. We also reached to our medical providers and our daycare centers. We literally go into the daycare centers. We look and see, we map to see where they are, where are those cases. And in our last meeting that we had day before yesterday, one of the strategies is that we're taking a look at where are they by ward. And then you'll see me come back in to you and say, I want to come into your ward to talk about this, because I want to make the connection between the daycare and the school of where the children are being impacted or that are being diagnosed as cases, so that we can really put our hands in and talk about, it's good old-fashioned public health, hand washing. So yes, we do advertise. We do have social media where we're reaching people as well.
Unlike Alderman, do you have an expense account for that advertising to get the word out?
It's very, very, very tight.
Okay, so after this meeting, I'd like to meet with you, because I don't want to broadcast it out in the public, but I have a great way I think you can advertise a little better, but if I let it go now, it'll be stole.
Okay.
And
You just share it with me. Okay.
Okay, I have something for you.
Okay.
What do you need most in the city? What the city is lacking? What do you need most to help us conquer what we're trying to conquer as far as health is concerned? What are we Don't get in trouble.
No, I'm thinking about it. I think I'm pushing more education. We have to help people understand, but we need to bring it down a notch. We have to, and it's not saying people don't comprehend. Sometimes we get so wrapped up in our terms that we don't put it out in language that our clients, our citizens can best receive. As it relates to HIV, the struggle that we see is, where are the young people going? We know that they're social media, so we need to, and that's what we do, we go that away, We know that they go to the spot, because the spot is so user-friendly for them. But there's still a number of young people who just don't understand that it will happen to them. And they have to respect themselves, and they must protect themselves by using a condom. And I think the more times we can deliver that message, going into the schools, but being respectful of that system, because it's age-appropriate protection and education that we have to impart in those schools. You just can't bust open the door and say, everybody put a condom on. You can't, do that. But I think through education, self-esteem, really directing it around building children's self-esteem and resiliency skills is significant in what we need to be doing. So I would say it's more education, helping people understand health care is not free. There's a cost to delivering services. It costs someone something to deliver those services, and that we're in partnership with someone to be able to provide those services at a reduced rate for them.
Have you heard of the new drug out there, guy called lean?
No, I haven't.
Lean is a Robitussin or any cough medicine with a Tylenol crushed up in it. They shake it up,
Something else.
and they call it lean because it do you just like if you had snorted or consumed some heroin. So they lean, when they get high, they lean to one side or the other. But this is an epidemic that's going on in the community, and they sell it in most of our stores across the counter, the $5 for a spoonful. And you can find out where the lean is being sold, because when you go to those stores that sell it, you look at the counter, you can see the drippings from the medication across the counter, and they're selling 10 and $5 spoonful of this medication, and we're wondering why these children are going wild. It's because of this new drug that's out, and the K2 chemical, the synthetic marijuana, is all over our city. And it's an epidemic worse than those dogs, and I think we need to get proactive on that and start looking for that and finding out, because people are talking about it. It's the new thing, is in all their songs and all, lean. They walk around, have it in cups, and they drink it all day.
When you said lean, the terminology that I was familiar with was serping or something like that.
Yeah, it's
But
the same thing.
Same thing. Do you have data or some stores in your area that maybe we can talk about?
We have several.
Okay.
I've informed the police and everybody, but they still leaning.
Okay.
Yeah, so I thank you. That's enough for me and you today.
Thank you.
Alderman French.
Thank you, Mr. Chairman. I'd like to ask you about Connect Care.
Yes.
So, first of all, how much funding did we provide Connect Care, if any?
$5 million annually.
So the city gave them $5 million. Once Connect Care closed, where did that $5 million start going?
That $5 million goes to, as a match, to draw down the $25 million that we received from CMS, so that we can have Gateway to Better Health.
Okay, and
And it goes to the federally qualified health centers in the city.
so it gets dispersed as a small portion, as a matching portion to
Yes.
existing health centers.
Mm-hmm.
You kind of mentioned a little bit about your efforts to fill that gap, that void, once Connect Care closed. Can you go over that again? What efforts have been made to fill that void?
We convened a meeting shortly after being notified October the 28th, and we brought in the universities, we brought in the federally qualified health centers, and the spot, and a private provider that we had a relationship with. And we talked about the numbers, what we felt that 20% was, and their capacity, excuse me, and their ability to meet the need. And there were 3 entities who agreed that they could assist, because when we talked with, and some of the People's Health Center and Grace Hill were on a conference call with us, and the other providers were actually in attendance to the meeting. WashU was in the process of building a facility. They said they would not be ready to receive. They couldn't do it. People's Health Center said it was more of a capacity issue for them, that they wouldn't be able to take on the additional numbers, because at the time they were looking at how they were going to address the whole urgent care piece. The same with Grace Hill. So the spot, we looked at the data and we saw that a large percentage, and I don't remember that number, the cases were youth, and they had the capacity to stand up to assist us. Downtown urgent care, North City urgent care, because we wanted to make sure there was a provider north to be able to assist and provide services for us. So they were able to stand up. And then further down You know, at Skinker, we knew that the current provider was seeing some patients as well, and we figured they would go there too. So those were the agents, the organizations and entities that stood up and said, yes, we can assist you with this.
So the three organizations are the SPOT, Downtown Urgent Care, and then the Downtown Urgent Care also opened.
Urgent Care.
It's the same people that opened the North City Urgent Care. Where's the SPOT located?
SPOT is located on Euclid
Okay, in the Central West End.
in the Central West End.
Downtown Urgent Care is located where?
On Olive, I think it's 916 Olive, something, 911 Olive.
And then where is North City Urgent Care located?
6613 Ridge.
And so the funding for those to make up for the gap of the closing of Connect Care were spread among those three organizations, one central, one downtown, and one near North. So what about North? Why are there so few health facilities north?
Well, you have North, you have Myrtle Hill, your Davis is there. North City Urgent Care, which has seen a lot of patients.
I expect they would once Connect Care closed.
Yeah, they saw a lot of
They
patients.
can't fill the gap of Connect Care.
However, what we saw was also an increase in the number of patients that were being seen downtown urgent care too.
Sure. I mean, I understand people, you know, when they need urgent care, they're going to go where they have to go. In many cases, they have to travel, you know, away from their homes in the neighborhoods. So, I mean, what I'm concerned with is that there's just such a lack of attention to some of our neighborhoods and the health needs in those neighborhoods. Are you familiar with the community health assessment that the city did in 2012?
Yes.
I think that's a very useful tool. It was very comprehensive. And one of the parts that came out of that was the survey of the citizens that participated in the study. And one portion of the assessment actually conveys some of their sentiments. There was a question on there: what are residents' perceptions and beliefs about the role of the St. Louis City Department of Health and city leaders in their health protection, promotion, and restoration? The answer from citizens was residents conveyed their lack of knowledge about the role of the Department of Health, particularly after the closing of community-based clinics. They don't see the agency as a visible force in the community, at the community level, and suggested that the health department staff should attend neighborhood association meetings to share information and become more accessible. But this is the part that really got me. Across the city, not just north, across the city, residents conveyed disappointment with city leaders and elected officials, expressing their belief that there is more of a focus on downtown St. Louis and less on neighborhoods. Many residents don't believe there is a vision for the city of St. Louis. Most residents expressed a need to see more emphasis on bringing residents together to solve problems, rather than separating the city according to race and geography. And this is in the health assessment here. And so, is there a strategy for bringing more resources to neighborhoods, especially health-related, more urgent care facilities? You know, it's great that the downtown urgent care facility opened a facility near North, but that one single urgent care facility can't meet the needs of the 100,000 people that live north of Del Mar. So is there an effort on the part of the health department to create more urgent care facilities, partnering with existing hospitals or existing service providers to meet that obvious need, and not just keep having folks north have to travel out of their community for the most basic medical needs?
The plan that's in place, and you're familiar with the Regional Health Commission?
Oh yeah, they've been around a long time.
Is the convener, and we sit at that table with hospitals as well and working through the integrated health network and looking at the gaps in services. Does the Department of Health have the ability to build? And no, we don't. We don't have the ability to do that, but I think we have the ability to describe the problem and sharing the data, what the data says, and that information from that report. And I know that efforts are moving forward in looking at what should be going on and reaching out to those entities who have the ability and the capacity to build those facilities, to create more of those urgent care facilities. I know Grace Hill has done a great job doing that. People's Health Center has done a great job doing that, and as well as Myrtle Hilliard Davis. Personally, I don't know what their individual plans are to recreate or create additional sites yet. I don't know.
Sure, but those are private organizations. They do great work, but they're private organizations. I think what the people of the city of St. Louis are looking for is for a city government to lead that effort. And I think we had an opportunity when, we freed up $5 million that we were given to Connect Care. We have an opportunity to use that as a carrot to get organizations, to lead those organizations to fill that need that we obviously have north. So if it's something I would ask you to leave with is that is a priority. It is expressed in your own document here, the assessment of 2012. It is something that we hear about constantly. And yeah, people deserve and need health facilities in their neighborhoods. And they shouldn't have to hop on the bus and travel 30 or 40 minutes to an urgent care facility.
I agree with you, and I believe that part of that planning that's going on now is we know that the $5 million goes to support the $25 million that comes in to support Gateway to Better Health. And I believe that group of individuals are looking at what happens beyond 2015 once we know that we've gotten through the initial sign-up period and what happens on the other side of that. What are we going to do, and whom are we going to be doing that
Is there a
with?
deadline? Has this committee given itself a deadline?
I don't attend that meeting, but I'm sure the director could provide you that information.
If she would. Has this committee...
Could you step forward?
Has the committee that the commissioner described that you sit on, has it set a deadline for when to come up with a recommendation or a plan, or even to provide funding in some way, or a recommendation for shifting funding to meet the needs of neighborhoods, especially in North St. Louis?
When Connect Care closed, first they closed specialty care, and most of what they saw was specialty care. When we looked at their urgent care load, it was upper respiratory, it was OBGYN, it was things that you could get an appointment for, and was more primary care. So they shifted specialty care and primary care to Myrtle Hilliard, Grace Hill, the facilities that were already there. When they finally made this decision to close on urgent care, I absolutely demanded that they address urgent care in the facilities that were already there. And Myrtle Hilliard and Grace Hill both added Saturday and Sunday hours and extended nighttime hours for urgent care. Grace Hill has, they all spent about $1 million to do that, to add doctors, staff. They didn't do this at no cost. Grace Hill has seen an increase in patients. Myrtle Hilliard, not so much. But that is their plan to address what Connect Care was delivering. The issue with Gateway is it is a Medicaid waiver that is only approved on an annual basis. It ends in December unless we get an extension, and it ends under the Affordable Care Act in December of 2017, no matter what we do. So the only way we're going to address North St. Louis getting the care they need is Medicaid expansion. Gateway to Better Health only gives money to not-for-profits, and no one else is going to go into North St. Louis unless they can bill Medicaid. I mean, just talk to Dr. Sager, who's trying to run North City urgent care. It's killing him that, he can't, that he's got a huge population that comes in there he's got no billing source for, and he sees them anyway, but he's losing money at that site. And the only way anyone's going to go into North St. Louis is for us to get, for the state to do what the president has asked them to do, and that's expand coverage to all.
And there's nothing the city can do?
There's absolutely nothing we can do. We've been to Washington several times. I've been to the White House. I've been to Jeff City. The mayor's been to Jeff City. We are doing everything in our power to do, but it's millions of dollars. The state's losing $5 million a day because the legislature won't pass Medicaid expansion. We're going to go the opposite direction. We're going to lose employees. We're going to see hospitals all down I-70 and 44 closed in the next 12 to 24 months. This is serious. This is serious, and they are not being rational.
Mm-hmm. So when I ask you there's nothing the city can do, I mean there's nothing the city can do to meet those needs.
If I had $20 million, yes. That's what St. Louis County spends on their clinics,
On all their clinics, not one clinic.
on all their clinics, $20 million.
How much does one clinic cost? What's roughly the budget of the Northside facility?
It would be about $5 million probably to run an urgent care center, right?
Okay. All right, that's all I had. Thank you.
Alderman Vaccaro.
Just real quick because of time, but are you guys doing any education? One of the things I guess that hits my neighborhood is heroin. And heroin, the use of heroin, kids dying, and of course, there's burglaries going on. Are we doing any education on heroin and the effects of heroin anywhere in the city?
This year we didn't. Last year we did. When we're talking to the population, we talk about it globally because we're dealing with STDs and the behaviors that are associated with that, substance abuse and that kind of thing. So it enters that, and then we make the appropriate referrals and letting people know where they can go to get assistance. Through our our data that we take a look at, we do share that with providers and pressing the point that we need to do a better job with putting together a plan. Again, it can't just be the Department of Health to do it all by themselves. We need to reach to other people to be able to do that, other organizations as well.
So are you doing that?
We've tried to do that with what we have. Could we do more? Yes. Which means there's a shift. There's going to be a shift in our focus.
And do you support the police carrying Narcan then?
Yes.
Narcan, the anti-drug wake shop. I'm sorry.
Yes.
So are we working toward that right now then, or?
That's something that we would need to be talking to the police chief about.
He's here.
And what our role would be in that. I could see us as being educators on the harmful effects of heroin and how the police department would handle that. I think that would be a conversation for our police chief.
Okay, well, no other question, but I hope you start working on the heroin epidemic, which is causing a whole lot of other issues, not just the kids dying.
Alderman Carter said you don't have any questions. Any others from members of the committee? Alderman Williamson?
Just real quick, what is causing the polio? I mean, why is that coming back? Is it a lack of vaccine?
I'd have to look that up to
Okay.
see what what's associated with this new increase. I don't want to just put something out there.
Yeah, I was just kind of wanting to see if you knew. Okay, thank you.
Thank you.
There are no other questions from members of the committee. We do have two other alder people here. Any questions? There are no other questions. We thank you.
Thank you.
Your report's very comprehensive. Thank you. Don't forget, we would like to get that information from you. Okay. Next, we have up the chief. Police Department.
Good morning, and thank you for having us back again. Before the chief comes up, I want to address one of the issues that we talked about yesterday in reference to excise and being more proactive in neighborhoods, as opposed to not just proactive in business. But we are looking to add a sergeant into that division from the police department so that we can be more focused in that area. That's going to accomplish a couple things for us. It's going to give us the opportunity to aggressively go after pro-business where we have issues with illegal drinking. But it's also going to give us a chance to really spend more time working on neighborhoods and going in there and be more effective. Now, when it comes to the level of involvement as far as what's legally sold and not sold. That's more the chief's area. He can probably help you in that area. But I just want to let you know that the concerns are being addressed because it's extremely important for us to do that. So with that being said, I'd like to bring up the chief now.
Thank you.
Good morning.
Good morning.
This one, that work? I wanted to start this morning with just a couple of comments, if I can, just about the department's budget overall, and then I'll be happy to obviously answer any questions or clarifications that you have. So the department has met its general fund allocation of $117 million, and the request matched the line item budget submitted to E&A and the one that was approved by E&A. The transfer of so many functions, but because of local control, does not facilitate an easy apples-to-apples comparison. However, combining the police department's allocation, including our pension costs, with the units transferred out and some that were transferred in to other parts of city government, result in an increase of $6.2 million in our budget, or about 3.52%. This increase does not include the effect of a $3.1 million encumbrance for health insurance that was used to decrease this year's current budget. I appreciate all of the efforts that were made by Paul Payne and his staff to assist us with meeting this allocation. The transition to city control and the transfer of so many personnel and functions has created a challenge for all of those concerned, but I think we've come through it very well. Including contributions to the pension plan, 92.4% of the department's budget goes towards salaries and benefits, including a $35.7 million contribution to the commissioned police retirement system and a $3 million contribution to the civilian retirement system. The difference in our commissioned staffing request is modest. As Colonel Gray talked about, we have added 3 police officers, 3 commissioned positions, 2 for our firearms unit, and 1 to deal with excise issues. I'm really excited about these additional officers that will help the city deal with gun issues, gun violence. The 2 positions will be added to our firearms examination unit. Our unit is currently half the size of St. Louis County's, and the additional position to the excise commissioner will allow us to focus on issues that we are seeing around not only late-night economies, but also retail establishments in the neighborhoods. In FY14, our general fund commissioned staffing strength was 1,245. When you add in the grant and contract officers, it brought the total number to 1,296. FY15, general fund commission proposed strength will be 1,251. When you add in the grant officers, it brought the total to 1,309 officers. The city was awarded a COPS grant for 10 officers. There are 2.5 full-time equivalent positions budgeted as part of the match that we're required to make in the 1,251 general fund positions. I have also requested that 1 captain's position be upgraded to the position of major. As we begin to transition for control of the airport, that position will be sent to the airport and manage the day-to-day operations. While we are working towards a July 1 deadline for that transition to take effect, I think there are still lots of issues that need to be resolved, and that date may need to be pushed back further or later into the fiscal year. An area of concern for me is always commissioned overtime. We are on track to spend $5.2 million of overtime in the current year. And overtime in the police department are used for programs that target specific crimes in specific neighborhoods, but a significant portion is also used for officers' appearance in court, which we have very little, if any, control over when officers are summoned to court. So we cut back that allocation to $4.2 million to match the budget director's recommended allocation, but that concern that our spending will exceed that going into next year. Overtime allows us the flexibility to target efforts necessary as part of our hotspot policing strategy, as I've said. And because of the continued growth and benefit of cost of overtime, it is sometimes more effective to use overtime than it is to hire commissioned staffing people. So we can pay our existing staff overtime to work and not hire new staff, which includes having to pay for fringe benefits and pension expenses. So overtime is sometimes a more effective tool to targeting neighborhoods instead of increasing the TO for the department. I feel fortunate that we are seeing only an 8.1% increase in our insurance cost from United Healthcare. As you may or may not know, the department's healthcare is separate from the city's healthcare. And so I believe the city saw a slightly larger increase, but our increase was 8.1%. I'd like to thank Monica Green from Police Department and Rick Frank and Linda Thomas for their work in helping to keep those insurance costs as manageable as possible. Unfortunately, as I alluded to a little bit earlier, FY 2015, we will not have the advantage of a prior year encumbrance of $3.1 million that lowered our budget request, and so that's why it becomes another reason it becomes difficult to do an apples-to-apples comparison. The good news is that in FY15 we will have a true cost of what it requires to provide health care for the department's employees. Something that I think is interesting that I wanted to point out, the department's health and dental coverage per employee, so the Metropolitan Police Department's coverage versus the city's coverage, is $1,464 less per employee than what the city pays for a lesser plan. And while I'm not a healthcare expert, we have a younger, more fit workforce that does not use healthcare at the same rate that city employees do. So therefore, our experience data is lower, and therefore our rates are lower for a more generous plan. It's also worth noting that since 2013, the city, September 1st of 2013, we've hired 17 civilian employees. Those civilian employees are in the city's insurance plan, so each of those 17 employees costs $1,464 more than it would if they were included in the department's plan. So it's kind of an interesting paradigm that's created there. I would have liked to have added some administrative staff to handle additional paperwork burden that the department has seen. The department used quite a few technology solutions. Example, PeopleSoft, our time management program, our personnel management program. The city does it in a paper form and in a different form, so those two systems still aren't compatible. The paper systems are, as you can imagine, a little more cumbersome. In anticipation of local control, we eliminated positions in the previous budget year. It would have been nice to have those positions back to make the transition even more smooth, if that's the correct way. I think it's important to notice that I've taken most of the capital equipment out of the general fund request. The allocation simply did not allow for capital expenditures inside the general fund that the department was allowed. And kind of a unique situation that we find ourselves in now, the department's sidearm, the duty weapon that officers carry, is in need of replacement. The allocation that you have in front of you that was presented does not allow that sidearm replacement through the general fund. However, in working with Paul Payne and the Budget Division, we are working to establish a way to liquidate our historical inventory of weapons in the department. As you can imagine, over time we've accumulated things like Thompson machine guns. Thompson machine guns no longer have a utility for us in law enforcement, and so we have between 28 and 30 Thompson machine guns that we would like to sell, and they have some value. So when we do that, the total cost to replace the department's sidearms over 3 years are $1.2 million. We think we can, by liquidating the department's historical inventory of weapons, we can cover all but about $300,000 of that. That's if the guns are sold at the value that we think we have. So that is a way that we can move forward without impacting the general fund to replace the duty weapons that the officers have and that I believe they need to be replaced. An interesting thing is that duty weapons have a foreseeable future, a foreseeable life, useful life. So what I would propose is, going forward, that in much the way that the city does its 27th pay, that we allocate between $100,000 and $120,000 in each budget into an account that in 10 years we will have enough money to replace the sidearms of the duty weapons for the officers, so we don't find ourselves in this situation again. The historical inventory we have is a one-time solution and doesn't provide for replacement in 10 or 15 years, which will need to occur again. As I mentioned, there are no capital, or very little capital in this budget. There are no vehicles included in this budget. The department historically has taken any money that they have left at the end of the year and put that into purchasing vehicles for the department. While it has worked, it is not a true vehicle replacement strategy, and on a going forward basis, I'd like to come up with a true plan that either on 3 or 5 years has vehicles put into the general fund budget as a foreseeable expense. And I kind of talked just for a second in closing about the transition from state control to city control, and some of the challenges that we're having around paper systems versus electronic systems. I am excited about the comptroller's effort into New World. We think that with the implementation of New World, that could solve some of our problems, but from what I understand, their implementation of the New World system is now not in this fiscal year, but the beginning of the next fiscal year, which still leaves us, a year or so with a system that could be improved slightly. So those were some of the high points from the budget, just some of the issues. I think the key is over 92% of our budget is people expense, salaries, benefits, and pension costs. Our benefits, our insurance is less than currently the city employees are paying for their coverage. Our staffing increased modestly from 1245 to 1251. Overall, including contracts and grants, we went from 1296 to 1309. Most of that is from a federal grant that we received for 10 officers, where we have to require to make a match for the next 3 years. And again, no real capital in this budget at all. Thank you.
Thank you. Questions from members of the committee? Alderwoman Cruzen.
Not at this time.
Not this time, okay. Alderwoman Florida.
I have no questions at this time.
Alderwoman Behringer.
Yes, clearly it's not in here, but the St. Louis nonprofit, the St. Louis Police Fund, isn't that the name of the nonprofit?
St. Louis Police Foundation.
Thank you. I just wanted to point out, how much money is it they raise each year that assists the police department?
Right now, they have committed $3 million, just as an example, $3 million for the purchase and completion of the new headquarters building, which will be done shortly after the 4th of July and will be moving by the end of July into that building. So they raise in the neighborhood of about just $1.5 million to $2 million a year. I don't want to quote their number for them.
Right. I just wanted to point it out because I know they do a great job, and I know that we shouldn't be depending on nonprofits for our police department, but they are doing a great job, and I appreciate it.
They do, and just for those of you that aren't familiar with the Police Foundation, it's a group of business people from around the region, around the community, that have come together and support the city police department and only the Metropolitan Police Department by providing training that is outside of the budget, by providing equipment, everything from night vision glasses to radar guns, to specific equipment for our SWAT team and our bombing and arson unit. So they've done a great job, a fantastic job, and I can't say enough good things about them. But again, it is nothing that can be budgeted for, and it is nothing that certainly that we could even think about bringing into the budget. And if you can, just for a minute to touch on the building, the 1915 Olive, the new police headquarters, will be done late June, early July. That building was purchased with drug money. It was purchased with asset forfeiture money. The renovations were completed by money that were in bonds and a generous $3 million donation from the Police Foundation. So no general fund money was used in that headquarters building, and so it'll be a great facility when it's done in the next couple months.
Does that complete you? Okay. Alderman Williamson.
Thank you. It's a very thorough overview of the budget. Appreciate that, Chief. And that was one of my questions. So in moving over to the new headquarters, it'll be no cost to the police department. You've already accumulated that money through, drug money, just like you said, and what have you. So there's no extra cost to this budget or any future budget by making that move.
That's correct. The purchase was asset forfeiture. The renovations were bond money, asset forfeiture, and the Police Foundation money. So no general fund money has been used in any part of this project.
Okay. What about the morgue? Is the morgue moving, or
it is not?
What's going on with that?
The morgue is separate. That's its own standalone department. But the city police department has 4 buildings in that complex right across the street. So police headquarters, which is 1927 construction, our police academy, our communications building, and then our new laboratory. The current plan calls for only the existing police headquarters, 1200 Clark, to move. There is conversation going on between Jim Garavaglia and the Comptroller's office, Dennis Jinkerson, and myself about a public safety answering point, a new 911 center, sometime in the future. But that could be a year, could be 3, could be 5 years. So the only building that's moving out of that 4-building complex is police headquarters, 1200 Clark.
Okay. And you mentioned you know, over a few, I guess, next year or so, or 2 or 3 years down the line, replacing sidearms. I was kind of confused when you kind of mentioned that. Now, what do you mean? This is $1.2 million to replace them, and what are you going to replace? Because you guys, I guess, carry 9 millimeters now, right?
Yeah,
And you're going to replace them. You didn't say Tommy guns, did you, or something similar?
No.
I was kind of confused about that. So
The current weapon that we carry is a Beretta 9mm 92 series.
Okay.
Beretta no longer makes this series of guns. It's very important from a operational and tactical perspective that officers are outfitted with the same weapons platform. So since they don't make this gun any longer, when we go to hire new recruits, new police officers, they're going to have a different gun. For training purposes, for safety purposes on the street, we want everybody to have the same platform. So we're looking about $1.2 million to replace the 1,300 or so guns that we have in the police department. We do not have that budgeted. We have a historical inventory of weapons, Thompson machine guns for an example, which have no utility or no purpose for us in law enforcement now. So to sell those to federally licensed firearms dealers, and then these guns certainly could be liquidated to a wholesaler with some restrictions on them that they're not allowed to be sold to the public. They have to be sold to a law enforcement agency, some things like that to try and keep them out of circulation. So the idea is to liquidate the inventory that we have to pay for the new guns, and then on a going forward basis, budget some money so we don't get into this situation again.
And what about your vehicles, the Malibus? I know they're getting a little old on you. How are you going to phase them in order to get some new vehicles to...
And this is an interesting, and I think it's another point to point out how the foundation has assisted us. The Impalas that we drive now are police packages, and so they're front-wheel drive. The Police Foundation has offered to upgrade some number of Impalas to Tahoes. The officers like the Tahoes better. They're roomier, they carry more equipment, but kind of well, I don't know if the officers completely intended this. I think a wonderful byproduct of that is they're safer when they're involved in accidents. So it's the larger vehicles which have no additional cost to the department. We would buy an Impala, the foundation upgrades them to a Tahoe, have probably helped reduce our workers' comp issues when officers are involved in accidents. So we're working on with Rich Bradley and BPS on a true vehicle replacement strategy. We're also looking to see if the Chevy Impala is the right vehicle for us, or Ford has come out with a new Interceptor. What's the right vehicle for law enforcement? I will tell you that front-wheel drive is key, or all-wheel drive. The Tahoes are rear-wheel drive, and during the snowstorms that we saw this winter, although the 2 or 3 weeks, they presented some challenges for us. So I would never see an entire Tahoe fleet, but I see a mixture of front-wheel drive and all-wheel drive vehicles.
So no Tahoe that's four-wheel drive, all of them rear-wheel drive?
The Chevy just introduced a four-wheel drive Tahoe with a police package, which will be available in August. We're currently evaluating it, so it's a little early for me to say if the four-wheel drive Tahoe is the right solution or not.
And they're more expensive too, I'm sure.
More expensive than the two-wheel, yes. And so then the question is would the foundation cover that incremental increase as well? And I don't know the answer to that yet.
And my last question, you kind of touched on that briefly. Workman's comp, is that increasing with the department, or is it pretty much at a standstill? Do you see a increase of workman compensation with the
I think that's a great question, because we have seen significant successes in that. And Monica Green is here, and I'll ask her to comment on that just for a second. I think there are a couple of reasons that we've seen a decrease in our workers' comp. One, our mandatory seatbelt requirement. I think the larger vehicles have had an impact, and in some education that we've done. So if Monica, you want to talk, we've got going back to 2000, a historical look back at our workers' comp issue, so she can give you a perspective from the police department.
All right.
Yeah, what I went back and did is I ran each fiscal year from 2000 to 2012. And just to give you an idea of the changes, in the year 2000, we spent $5.5 million on workers' comp, and we had 474 claims. If you go to 2012, which is a full fiscal year, we spent $2.4 million on workers' comp, and we only had 328 claims. Now, in those claims also includes 2 officers who were injured, one in the 70s and one in the 80s, both of which are either quadriplegics or paraplegics. One of them has passed away. So that also reduces our costs substantially. To give you an idea of where we stand for this year, I'm not even going to mention the costs because they're not mature claims. But as I said, we had 328 in fiscal year 2012 to 13, and we've had 193 so far this year. The less claims we have, the less settlements we have. The less settlements, the less payments.
Okay, thank you.
Thank you.
I'm finished, thank you.
That complete you?
Yeah.
Alderman Moore, any questions?
Yes. Chief, by your name being Sam, I expected more out of the police department by this time. My community is out of order. It has gone completely wild. And when you come in office, I expected a lot from your office to my community, tax-paying 13,000 people that feel that we've been deserted. It is absolutely amazing. The other day I walked out after the shooting, after about 50 rounds that went off, I went outside and there was the smell of gunpowder like the 4th of July. I got on the phone and I called. Police responded, but they came to my house. They sat in front of my house. I had to stand there and say, hey, sir, would you please move that car from in front of my house? Because it's fronting me. It's putting my life in jeopardy because if people are so revengeful now about doing things to individuals. They don't care about me being an alderman. They shoot sheriffs and anybody else to get in their way while they're committing whatever they want to do. You have a budget, and who wouldn't want this budget? In Budget Division 650, you got 10 pages. In the funds 1010, you got 26 pages. I know you're a fan of redistricting. I don't see it working. I see a void, Sam, may I call you Sam?
Absolutely.
Okay. In my community. I came to your office and I gave you some spots. I talked to you and the colonel about some hot spots. Greer and Newstead, between St. Louis Avenue and Natural Bridge is a forest. It is a joke of times. It is so far out of order. It is amazing that, and when you were here, you heard me talking about the lean. Those stores are selling this medication, right? Ray Charles is blind and dead, and he can see it. It drips across the counter. And it's going on, it's an epidemic that has started, and we need to be proactive about it, getting to nip it in the bud to stop these stores from selling these products, and so the people don't continue to do. But prostitution, all of the crime is committed basically in my ward, and a lot of it you don't see because people sweep crime under the rug. When they do crime, they just do it to one another, and then we're revengeful. That area there is out of order, man. I mean, it is so scary. It's scary to even ride down Newstead between St. Louis Avenue and Natural Bridge. It's scary. And it's been going on. I moved in the neighborhood in 1956. You didn't create the problem, but the problem needs to be solved. And it's a very obvious problem that people are doing their most illicit activity in this particular area of and I see you, when I see you stand in the hotspot areas, it angers me to see you stand there when I've asked for Greer to be taken care of and it hasn't been taken care of yet. It's an immediate problem. We need some attention on this right away because it's gone wild, and I need your help. So like I said, I expected more out of Sam by this time. In my district now, we got 8, instead of the 8, we have the 6, right?
The 6th district, that's correct. You're part of the 6th district.
I'd like to know how many officers patrol the 6 in my community during the day and at night. It has been rumored that I only have 3 officers patrolling east of Newstead after a certain hour. And with all this money that we have in this budget and this great police force that we have, I need to see more of a police presence. The criminals know how often we patrol. That's why they're doing what they're doing and getting out of order. I continue to tell you that it's getting out of order. And one thing I would like, this is my last request, is that I don't know how we stop this, but when the people call the police, this is why they're not engaged in police activity and don't want to tell, because they're still knocking on their doors and asking them, did you call the police? And the one you call the police on is standing there. It's hard to say, yeah, I called the police on that man right there because of the retaliation that's going on in the community. So we would appreciate it if we come up with a different method. It's an old method, knocking on my door, asking me, like I said, I called the police the other day and the cop pulled up in front of my house. And I'm sitting on the side of my house where the people couldn't see me, and I just had to tell him, would you please move that car from in front of my house? Because he goes home into another neighborhood and I have to stay there and suffer the consequences. But I know redistricting is one of your favorite gadgets, but I don't think, I see a void. And I would like to sit down with you again and go over that so we can, I have more than that hot spot on Greer, but that is my hottest spot. And then I have a lot of them that's raising up 4400 block of St. Ferdinand. Anytime I'm on my way home and I see 30 and 40 people, 30 to 40 people standing on the street, it's amazing. The 4200 block of St. Louis Avenue, they had a block party the other day. So they took St. Louis Avenue is a 2-lane street. They took the westbound lane, put some cones out in the street and partied in the street, and no one did anything about it. And we called and called. And the Alderwoman Tyus really called me and just gave me the blues about it. I told her, I'm not the police. I can't police that. But people are just taking over because they know that they're not going to be responded to, and there are consequences in their activity, but they don't know what the consequences are. I think we need a little more enforcement on that. That's all I have for now. I got a whole 2-3 sheets here for you, but that's all I have for right now.
So, hey, first, I appreciate you acknowledging that this problem started much before we got here. I think you said you moved into the neighborhood in 1956, and so there's a systemic problem that's happened in the neighborhood over time. I think we agree on that.
It's been going on for a while.
So I appreciate that.
Best chief, though.
And, well, see, now I like that. Now you said that you had a little more faith in me now that my name's Sam.
I expected more out of Sam than anything, because I want you to get in there and get it done because no one else has done it.
So, and you've called me about the 4200 blocks of Greer and some other streets, if I remember correctly, and we've talked to Ronnie Robinson about it, the major over the area that's there. You've talked about a lot of things, so let's kind of just work on them in any particular order. Continue to call the police. Here's the challenge that we have, and when we talk about anecdote like this, that you want us to do something about it. I want us to do something about it. We all want us to do something about it. That's not... But in order for us to do something about it, we have to have the cooperation and the participation of the neighborhood, which requires the neighborhood to go to court and follow through on prosecution with us. And so you wanted to talk about anecdote, about things that have happened in your neighborhood. I'll give you anecdote too. There are 4 homicides that we know who did it and are responsible for. 4 murderers that are walking the street because we don't have the cooperation of the people in the neighborhoods that know this to put them behind bars. So while the police can come and do something, and when we arrest someone, and there is nobody to follow through with the prosecution, then that person's right back out on the street. And we already know, and we've already talked about the criminal justice system, it puts individuals back out on the street in almost the identical situation they were when they went into the system. No additional education in many cases, no additional job opportunities in many cases, no change in their substance abuse issues in many cases. And so the police, we're the only ones that respond 24 hours a day, 7 days when you call. So when we do arrest somebody, and there's no follow-through on the prosecution, that person's right back out in your neighborhood. You've heard me talk about an armed offender docket, trying to find a specific path for people that we arrest with guns, and you talked about gun violence a minute ago, people shooting up into the air. The courts have kind of thumbed their nose at the city of St. Louis, at the department, at the board, at the circuit attorney, at the mayor, at the residents of the city of St. Louis, by not engaging in that conversation in a serious and meaningful way. So we can talk about anecdotes and we can talk about this all the way. We have talked about the 4200 block of Greer. We have made some arrests in your ward. Let's talk about the reality of crime for a second, though. And I will say it so nobody else says it. 1 victim is too many. I understand that. I want crime to be 0. I want us to make sure that nobody gets victimized. New York wants that. LA wants that. Detroit wants that. Every city wants that. That's what we continue to do. But the reality is, in the 6th district where you live, crime is down. It's not 0, and the people that are victimized are hurt by it, and I understand that. But incrementally, we are making progress, and we've been making progress since the peak of the crimes in the 1993. Since 1956, it's been a problem. Since 1993, it's been getting better. We're not there yet. We have a lot more work to do, but we need you, the Board of Aldermen. We need you, Sam Moore, as a resident of the neighborhood, and we need everybody else to come forward. And then we as a city need to have a united front when we talk about an armed offender docket, when we talk about how our education system works, all of those things. Because crime impacts the health department. I heard you talking to Melba and Pam about that. It affects the parks department, it affects the street department, it affects everything. It affects the perception of our city. We're targeted in hotspots, and even though some people call it political hotspotting, if you want me to come to your neighborhood, we'll come to your neighborhood because that's where the crime is, and that's what the data tells us to do. That's how we do it. That's why we're in the Wells Goodfellow neighborhood right now, because that's where the data told us to be. So we're looking for the next neighborhood to go into where we're going to have the ability to impact crime in a measurable way. And that's what you want. You want to be able to know that the metrics that we have, the systems that we have metrics and can reduce crime. That's all I'm trying to do. As much as I can, as quickly as I can, in as many places as I can.
There's no way Wells Goodfellow has more crime than Greer and Newstead. And I am the data for that particular community.
I'll send you both neighborhoods.
Call it political hotspotting, but it's not the right hotspotting because that Greer and Newstead is an amazing thing. And it's scary to drive, not just walk and live in that community. And people are frightened to death, Sam. I mean, everybody go home. You know, if we all was like the Wild Wild West and wore our guns, which they are, the criminals have them, but we don't have them. You know, we'll feel safer, but then you have a whole lot of gunplay on the street. But it is scary living in these communities now. And we don't see the police, and the criminals know the schedule of the police more than we do. I had 3 community police officers I thought that were doing magnificent jobs. I don't have one of them. I don't see any one of them. I think a binder might be still there. He can't do it all by himself. But they had a grip on the neighborhood where they knew where the bones were buried and knew how to get that information back to the police department to help us solve some of these problems that we're having. We have some tremendous problems. It's more than me and you jabbing back and forth over the podium about how the crime is going to get solved in this neighborhood. I have some great ideas, but, you know, it's always the reaction of the police. Don't tell me how to do my job. Like, you know, we can be told how to do our job as aldermen, but we can't tell anybody else how to do their job.
And I think we have that relationship where you were in my office. We were standing on a street in your neighborhood targeting. We brought the forestry department, the police officers, the street department and everything, and targeted some of the problems that you have in your neighborhood. We didn't get here overnight since 1956. We're not going to change it overnight. But gradually, incrementally, we're making progress. And so I'll check with Ronnie Robinson and see where we are in those 4,200 blocks that we talked about. But I think we also have to have a real conversation. We are making progress. And the men and women, and you talked about money for a second, all of this money in our budget, you heard me say that 93% of it goes to salaries. Hey, police officers haven't had a significant raise in a long time. They've done a great job of reducing their expenses and their costs, as Monica have talked about. I think mandatory seatbelts in the cars have dropped our workers' comp. The bigger vehicles have. Mandatory vest policies have changed that, bulletproof vests, ballistic vests. So we've done a great job, and that money hasn't been realized back into the police department because of increasing pensions, because of increasing gas, because of inflation, because of a variety of things. So I think we just are working the best we can with 1,251 officers towards a goal that keeps everybody safe.
Well, Sam, I don't think that the Board of Aldermen, myself, I don't think I qualify in even talking to you about salary. We make $40,000 a year, that's with expenses. So, and I'm sure your salary is triple that, so I don't know why we even qualify to talk about your salary. That's something I'm just talking about the budget, your budget period, but as far as your salary is concerned, anytime I'm making the money I'm making, I don't have the right to talk to you about what you're making. I just wish that I made some of that.
Well, do you want to tell the men and women of the police department that go out every day and risk their lives that you don't want to talk about salary because you think your salary isn't as adequate or comparable to theirs?
It's a man without a gun. Thank you.
Alderman French.
Thank you, Mr. Chairman. So obviously I share a lot of the frustrations of Alderman Moore from the 4th. But we'll get to that a little later. Let's start with the budget. What is your total budget for the department, including grants and other pots of money?
Dave Daniels, the budget director, I'll let him, because the pension costs are included in other funds. Things like gasoline are included in other funds. So I'll let Dave give you the most specific answer. I don't know if Ed or Paul can give
Yeah,
it.
there's just not a line here that has the total.
So it's 117 plus the pension expenses plus other things.
How much do we spend on policing? How much do we spend on policing? $136 million, not including the grants. Do you have a round figure for grants? $8.3 this year? Okay. That's a lot of money. So we're spending about $144 and some change $million a year on policing. That's a lot. That's a big investment that the city taxpayers are making there. Let's go through some of these things. I had some questions before we start. Under peace officer training, there's a line here that says education and training, chief of police, $250,000. Are we sending you to Harvard?
No, not Harvard nor WashU either.
Okay. What's that?
Why you see chief of police is because at one time, that budget had been broken up by bureau, so each bureau had its own travel budget, but at some point in time, there was a decision to consolidate all travel to the chief's office, so the chief would do all travel.
So that's $250,000 that can basically be used at the chief's discretion.
Right, and that's only if, Alderman, that's only if there's enough cash. So if in that particular fund, if there's only, let's say, $170,000, we'll only be able to spend $170,000. So it's an estimate, but we can only spend how much actually comes in.
And that money is specifically dedicated from the courts to, that money, if I'm correct, is just specific, that fine is specifically dedicated from the courts to police officer training. So that's the only fund, the only way that money can be spent.
And that fine is on what? That little fee, what kind of fines is that attached to?
It's city ordinance violations for the most part.
So a little bit of every city ordinance violation goes into this pot. In FY12, it had a negative number, negative $71. What does that reflect?
That reflects.
Oh, Ed.
That was the expenditure line for that year. That's when which fund it was being charged out of was changed by the council. So we put in negative $73 because that's the information we had. Money was moved during that fiscal year to another fund. Which one, I'm not sure.
But that would be somewhere in here probably.
It should be. It should be.
Okay, I'll hunt around for that.
And funds and stuff like that, sometimes expenditures are really hard to track.
Okay. In that same year, we had budgeted about $23,000 for education and training. At fiscal year 12. So are you saying that there was more than that, 25,000 or 24,000 available for education and training in fiscal year 12? Okay, and then the next year it jumped up to 156,000, and now we're at 250,000? Okay. All right, something to look at. Under miscellaneous grants, we've got $4.5 million under personal services. What is personal services? And that's different from salaries, regular employees, salary uniformed employees?
Yeah, could you speak into the mic, because not all of us are hearing you.
Because there is 3.8 million for uniformed employees, but then you have 3.4 for personal services. That's on, in my book, it's on 237, on the line item book. Oh, it's Fund 1140.
That police department has individual grants. About 150 of them or 200. And when we summarize them into the 1140, which is all of their grants, it has not yet been determined which exact, is it going to be for overtime, for salaries, for officers, or salaries for civilians. That's not determined this time because some of the grants haven't even started yet. So it gets lumped into a 5100 series, which is, we're pretty sure we're going to use it for personnel, but we're not exactly sure yet. Then the funds during the year can be moved and transferred out.
And an example of that would be the Project Safe Neighborhood Grant. Is that?
Right, if you notice on that same page, you'll see over into where the expenditures are, the monies have then been broken out as to what was spent. In our case, it's not until after it's expended that we break out which accounts it was actually used in.
I'm sorry, where is that?
Right, well, you're looking at page, you look over at expenditures in FY12 and FY13.
Right.
You'll see that if you go back to FY12 and FY13's budget, you'll see something very similar, just a lump sum of money in one account. But after they've spent the money, then we have the
broken down.
information, so we can't break it out.
All right, but, and the subtotal will be the same? The subtotal will be the same, you just spread the money out from the top line to the...
It's what was budgeted versus what was actually expended.
Okay. And under our current system here, how are those decisions made? Who makes those decisions?
On the grant funds?
Of how to allocate those.
Grant funds are based upon the criteria that the police department has to live with. For certain projects, over-the-road trucks, ATF, like I said, there's like 100 or so different.
Each of the grants that we receive will have some criteria. For example, we have a grant with the Department of Transportation to do commercial vehicle enforcement. They fund 80% of some number of officers to do that type of over-the-road enforcement for our highways. Project Safe Neighborhood will come, that has to be targeted in areas that have violence and will probably be spent on overtime once we receive the final grant amount. Every grant category has some specifics placed either by the state or the federal government about how that money is spent towards that mission, towards that grant purpose.
So do you know already exactly how you're going to spend that $4.5 million?
No, we do not. We do not.
Is there any process in place right now where you inform either the Ways and Means Committee or Public Safety Committee or anybody how you're spending that money or when those decisions are made or how you're going to spend that $4.5 million?
And I just want to ask kind of a point of clarification. Grants are much more specific. When you're talking about grants, they come with a specific purpose towards a specific end or specific goal. Those usually require a contract with whatever body is issuing the grants, and that goes through the normal contracting process of the MOU process in the city, and we engage into that. I think you're trying to get to the asset forfeiture amount. That's really what you're looking at.
No, I haven't gotten to that yet. That's coming over here.
Which is included
That's
in
next.
that amount. So that, the asset
No,
forfeiture...
I'm just on this one right now, so...
is asset forfeiture included in that grant amount?
No, that's a separate pot.
All right, so those grants come with specific missions, specific purposes, and they can't be retasked out of that purpose. And so they go through, and I'll look at Charlene, we've started going through the same process for grants that every other city department does. Some of the grants, I would say, are probably grandfathered in, meaning we entered in 2 years ago and they're a 3-year grant and they have to run their cycle. But any new grant will go through the normal process of a health department grant or...
So is this $4.5 million grant you've already received or grant you anticipate receiving?
anticipate receiving.
Okay.
And this is, I'm kind of asking a question of the budget. This is the process that we were told to do. This is our first budget under the city process, that in order for us to receive the money and to be able to spend it, there had to be an allocation. So we're putting the allocation into the budget. So once we receive the grant, we can spend up to whatever amount is allocated. Is that correct?
And so that question actually should have been,
I believe the police could provide it, would be just a listing of the grants and the grant titles, which gives you, you know, most of them will say it's ATF or it's Neighborhood Watch or it's truckers, you know, and that, if they can provide it, that's usually in the police, the old style police budget, where it listed the projects, the grants, and the amounts.
I think that would be helpful. And it wouldn't be just for the 4.5, it'd actually be for the 8.3, almost 8.4 million. You can just kind of give us an idea of what you're anticipating spending that on and in what areas. That would be helpful. Now the next pot, the asset forfeiture pot. So first, is the 3.1 million the total of what is available in the asset forfeiture fund right now?
That was the amount that was available at the time we prepared the budget.
Okay.
Asset forfeiture funds, you can't budget what you don't already have in place when you budget, okay? Now, since we submitted the budget and not knowing exactly when construction payments were going to be made, we've made approximately about a $600,000 payment on the new building. Okay, but you know, the asset forfeiture projects, again, you can't budget what you don't have, and that 3.1 million, that was everything, that was all the money that was available in asset forfeiture when we budgeted.
As of approximately when, April 22nd?
Probably in February.
But some of it's already encumbered.
Right, some of it's encumbered, but we were asked to budget the full amount, whether it was encumbered or not.
And what restrictions are there on asset forfeiture funds, if any?
A lot. Okay. It has to be used for a public safety purpose. It has to be used to benefit the police department. Any asset that's purchased with asset forfeiture, when we sell it, the money has to be put back into asset forfeiture. Asset forfeiture funds, there are very strict rules on whether it can be used for salaries. In general, it's frowned upon. Under certain circumstances, it can be used as a grant match. Okay? Under certain circumstances, it can be used to support certain community programs that qualify, and if you want, I could provide you a listing. However, that amount that can go towards community programs is limited to 15% of the average amount of revenue, asset forfeiture revenue that's been received during the 2 previous years.
So can you get us those rules?
Yes, would you like the book? Would you like the book printed or just the link?
I've actually already sent you that. In the request that you made in December, I referred you to the asset forfeiture guidelines, which are the ones that are still in place.
The book, please.
Okay.
And so...
I'll send you the link to the book, so you
Okay.
can have it, which you already have.
Actually, if you don't mind, the book. I like the
Send
book.
you the link to the book. Thank you.
Hmm?
We'll send you the link to the book.
Actually, I'm requesting the book.
We'll send you the link. Thank you.
I am requesting...
And we're sending you the link to the book in an effort not to increase our paper cost for printing it to you. So I'll send you the
got
link to the book.
$176 million, so I think you'll be all right. The book, please.
We'll
That's
send
my
you
request.
the link to the book, and I'll send you Mr. Chairman, can I send you the link to the book that you can share with the committee, please?
What was your question, Commissioner?
Can I send you the link to the book, which will allow
Mr. Chairman,
everybody?
the question is, I like the book. He wants to send me a link to the book. I like the book.
You can send me the link.
Thank you.
But if he is requesting a paper copy, I would ask that you provide him the paper copy.
There you go.
Thank you, Mr. Chairman. So back to the asset forfeiture here. So of the 3.1 million, you have already allocated 1 million to something called public health and safety, and then 1.8 million to something major projects. Can you describe what those are?
Major projects is a combination of 1915 Olive and property custody. And Alderman, when we were preparing the budget in April, I didn't really know what the status of both the 1915 Olive project would be, as well as the new property custody facility. And so I really took the balance of the amount that was available and put it into major projects because there are so many uncertainties at this point about the property custody facility. And so I would expect at some point that money will be moved out of that major projects line to some other function. But since I had to budget the full amount.
You had to stick it somewhere. I got you. So, so first, the issues with the property, do we know how much that's going to cost to move that?
The latest, and we've been working with the comptroller's office, and it looks like, we can acquire a property. It's, I think, a little over $1 million.
This would be a new property?
This would be an existing building, and so it's a new property, yes.
But so it would not be in the new headquarters?
No, it would not be in the new headquarters.
Yes, I can. The plan for that facility was never to move it into the new headquarters. We have an existing property at 4213 Gibson in the Grove neighborhood, and we were going to expand that building to house the property custody. Since then, we've been approached by Alderman Rohde about some development opportunities in that neighborhood that he's interested in and asked if we would consider looking at a different facility. So we're looking at a place on 59th Street, if I remember correctly, 59th Street, which would house our new property custody operation. The plan was always to take it out of the basement of our current police headquarters and move it to 4213 Gibson. Because the alderman has some interest in development opportunities there, we were looking for a new place to move it.
So is that going to increase the cost?
We don't think so. We think that if the GO, the capital bond that goes out, there's some money in there for that, we think we'll be able to cover it with the existing budget. The existing budget is about $2.4 million, which includes building, build out, move.
And so how much have you made, how much have you put in there in the GO bond request?
I'll have to get that, and I just don't have it right in front of me. I'll have to get that.
Oh, by the way, that is money. That does cost, that is money. So that's more money. Just because it's in the form of a bond issue and instead of general revenue, it's still money. Okay, so that's going to increase that cost. All right, and so we had to find two categories to stick that money in. You stuck 1.8 under major projects, 1 million under public health and safety, with the intention that that's going to be moved later on in the year. Now, how is a decision made where to move it? What's the procedure for that? Who makes that decision to move it and where?
Say that. I don't understand the question exactly.
So if all of the $1.8 million is not spent in major projects, as what happens with many departments and many line items, later in the year, that money is moved somewhere else. Who makes that decision to move it?
Is that asset forfeiture money, or is that?
This is asset forfeiture.
Asset forfeiture money, as I understand it, and speaking with Paul Payne, the process was going to be to go to E&A and to ask for monies to be transferred. But with any asset forfeiture project, and obviously some of them can be quite large, any asset forfeiture project that exceeds $100,000, we first have to get Department of Justice approval to move forward. And then in speaking with Paul Payne, we would then go through the Department of Public Safety, and then from the Department of Public Safety to E&A for approval.
So it never comes back to the board?
I don't believe so.
All right. You brought up GO bonds. The requests, what are the requests that the police department has made under the GO bond so far? I know that there was $11 million for a real-time surveillance center. I thought we talked before, I don't know if it was in front of the Public Safety Committee or the Ways and Means Committee last year sometime when you mentioned the need for guns and equipment. I thought that was going to be in there, but it sounds like you found another way to pay for that.
And I've got a response to your letter that you asked about the specifics of this. The request is, out of the GO bond for the police department, total all-in is about $12 million. I'll kind of step through it quickly just to give you an idea. The Real-Time Intelligence Center is about 5.9 million of that, not the 11 million. There are some other items in there, and just to give you an idea, and this is the updated as of 3/4, which I believe is the most current for the police department. Repairs to HVAC, elevator, flooring, lighting in our academy, $1.2 million. Repairs similar to that in our communications building, $66,000. Updates in our 3 area stations, similar to those, $700,000. Similar repairs in our supply division, $185,000. Repairs in the fleet service division, the garage on Laclede, $450,000. $145,000 at our undercover building, our range and our canine. $85,000 in our laboratory. There's $300,000 to decommission the police department headquarters. There's $2.3 million construction of new building for relocation of the property custody unit. $5.9 million for the Real-Time Intelligence Center. $120,000 for an AFIS workstation, which is a fingerprinting workstation, and about $30,000 for a comparison microscope. Gas chronometer spectrum, which is something we use in our laboratory, $120,000. Those together add up to about $12 million. And these are all available. This is the capital summary that Paul Payne prepared for the GO bond.
I've got a copy of that. So about $12 million you've requested.
Yeah.
Okay. All right. Under here, so now that, so getting to these other departments you're taking in now, park rangers. You are going to take over the park ranger duties when? When does that happen?
Right now, it's tentatively set for July 1st. And Dave Daniels just gave you a copy. He did have a copy of the Equitable Sharing Guide, which are the federal guidelines for asset forfeiture funds.
Oh, nice.
So that's the document that you
Not a lot of
requested.
paper?
And we didn't have to print it. It came printed already.
Look at that. I like when we work together, Sam. Look at that.
So the question about, the target date right now is July 1st to take over the operations of the Parks Department.
July 1st.
Yeah.
And it looks like you've got 28 employees there?
Sergeant John Vogt is here, and Sergeant Vogt has been working on the day-to-day operations, so he'll be the subject matter expert for us as we talk about the park rangers. So I just asked John to talk about his table of organization and the number of rangers that they have.
Alderman French, how you doing?
Good, how are you?
Good.
31, that's how many you got over there.
Yes, sir. We just hired 4 with our allotted amount is now 31 with 4 supervisors.
Okay, so you've got, so the park ranger manager, park ranger supervisor, and then 26 park rangers. The park ranger manager is still going to be separate. That will be he will be a ranger, not a police officer.
That position's been eliminated to my knowledge.
Oh, and it's in here. Park ranger manager?
Is this, what's it?
No, it was Strickle's position.
Yeah, no, that was the former chief of the park, and because of the operations, that position will no longer need to be filled. So,
He's in jail now, isn't he? Is that,
so the way that I understand it is Dan Skillman prepared the Parks Department budget for the park rangers, but if that position is in there, it does not need to be in there.
oh, that's 40 grand right there. Look
But
at
I'd
that.
like to transfer that to the sergeant in
Oh,
the
no,
police
I got
department.
dibs.
Because
I call that one.
we're taking additional responsibility and not adding any staff to handle those additional responsibilities, much in the same way we did with the park, or the marshal service here. We've taken over the responsibility and didn't add any staffing to take over the responsibility.
So so you're creating a new position to oversee the park rangers?
Sergeant Vogt is currently working in that, and we took him out of our current TO, out of another assignment to oversee the operations of the Parks Department. Park
Okay.
Rangers.
So what would you be doing then? You were looking to transfer that over through E&A later?
It's one possibility. We're still, again, the target date's July 1st. We're still working on some of the details. So I did not know that because we did not prepare that budget. It was prepared by the Parks Department.
Okay. So the 26 park rangers, how do you plan to distribute those park rangers? As you know, we have made a request to have permanent park rangers in Northside Parks, which we don't have, and it's been very disappointing. I saw that you have publicized plans to put more staff in Forest Park, and that's great. But in Northside Parks, we'd like to see some rangers permanently. What are your plans for that?
Can you talk about the overall deployment strategy so you understand the overall deployment?
Well, currently, we did some rescheduling of the way their hours are being worked, and it allotted us some additional manpower in the parks. For instance, Fairground Park is covered for the swimming pool season with 2 park rangers, and that's from June 9th through July 25th. They will remain in the parks for that shift. However, before a park ranger was assigned exclusively to a pool, now we're having 2 shifts of park rangers, which will enable us to not just be dedicated to the pool, but also be dedicated to the park as well.
So that's just 2 months, though. What about
Yes.
the other 10 months?
Currently, what I've been doing lately under our new scheduling is I do have a park ranger going to the North Park, so Fallon and Fairgrounds specifically, checking in at the rec centers and checking out at the parks as well. I also have one going to the South Parks. And then every day I have approximately 5 park rangers working. So 3 of the 5 are assigned to Forest Park. And I have...
So you have 5 working, 3
Yes.
are assigned to Forest.
Yes.
1 bounces around south and 1 bounces around north?
Yeah, but specifically to Fairground and O'Fallon, just, because of the larger parks.
Wouldn't it lighten the load on regular uniformed police officers if of the 26 full-time park rangers, we had 1 or 2 permanently stationed to those large parks in North St. Louis?
Well,
Or South St. Louis as well?
Yeah, I'd like to answer that, but to understand the full dynamics of what we have going on is the number can be deceiving because of the 26 park rangers you mentioned, 7 are dedicated to the rec centers within the city. So, for instance, at Wool Center at Kings Highway and Dr. King, I have 2 park rangers assigned from 7 a.m. until 10 p.m.
But not O'Fallon, right?
No, these are the neighborhood recreation centers. So of the 26 park rangers you mentioned, I have 7 that are dedicated to the rec centers, and they provide security for the rec centers.
Okay, so we take 7 out of the 26 to basically play security guard at those buildings.
Well, I think that's a necessary function of our job in terms of the safety and security of the centers in the neighborhood, and make people feel comfortable going to the centers.
I agree.
Okay.
That's why, both because of the size of O'Fallon and Fairground Park and because of the location of a new recreation center, you would expect that there would be a full-time ranger assigned, and we don't have one. So in order to get the kind of protection we'd like to see in those parks, would it require additional ranger funding? Is that the only way we'll get that?
I would say I also took, as part of the 26 you mentioned earlier, part of our function is to maintain security at the maintenance yard, which has got millions of dollars of equipment inside Forest Park. I have a night watch that I have three park rangers assigned, which allows me to a shift to cover the ranger base as well as the park at night. As part of that, we had 5, and I made it a skeleton crew to increase the park rangers in the other parks.
So you have 5 stationed over there in Forest Park?
There wasn't 5 assigned to night watch, and now there's 3. And So I was able to bring a couple of park rangers up to cover the other parks. I would agree with you that additional park rangers, a couple would be adequate to help cover the areas that you're mentioning.
Okay. All right, we'll look into that. I had a couple more questions about some of the other budget items. Pension costs. So a lot has been made about, we spend a lot of effort down here with the firemen's pension costs, but the police pension continues to rise, and the costs are really skyrocketing here. We look between fiscal year 12 and fiscal year 15, expenses almost doubled from 17 million to 30 million. Are there any plans going on right now to get the police pension costs under control?
There are actually conversations going on with the St. Louis Police Officers Association, the police retirement system, to try and to get an understanding and a handle. We have had many sit-down meetings and tried to come up with some options. As you know, that will have to be changed in Jefferson City. That pension is still controlled by legislation at the state level. There are no bills moving through this legislative session, which we know ends Friday. We're going to continue to work to hopefully have something introduced next session that would potentially have the ability to reduce that number. So it's a concern. It's of interest to everyone, but there is no vehicle moving right now that will address that for this fiscal year, or probably for next fiscal year.
All right, Mr. Chairman, I'll come back later.
Okay, then. Let's go to Alderman Vaccaro.
Hey, Chief, I do have a couple questions. One, I saw in the news this morning that one of the police cars got shot on hotspot policing.
There were some police officers in the Wells Goodfellow neighborhood last night about 9 o'clock or so that were shot at by some individuals. So yes, that is a true statement.
And didn't hit the officer?
No officers were injured during that incident.
I got just a couple, and I'll keep them very short. The park rangers and the marshals are both being brought into the police department. Will they be under security guards, or will they be licensed police officers? What's the plan?
They will not be post-certified police officers training standards act. They will not be post-certified police officers. I think it's probably a more correct representation to talk about them in the security guard light. Although the park rangers do have some post-training, their focus will still remain the marshals in securing city buildings, the park rangers in city parks.
Well, I mean, so just so
They
their title
will
will
not
be technically
right.
park.
They will not be commissioned police officers, and they will not be part of the police retirement system.
And then I'll just make this my last question, because I've been asked this. The police at the airport are coming into the city, and the question that I keep getting asked by mostly police officers, but even by the airport police that I know, are how are they going to be brought into the pension system? I'm told it's going to cost over $100 million to the city to get them in the pension system.
Currently, the way that the state statutes are written is that any police officer in the city of St. Louis that works for the Metropolitan Police Department needs to be part of the police retirement system. There is currently legislation in Jefferson City which would carve out an exception, one-time exception for the airport police, where they would have an option to stay in the ERS, the Employee Retirement System, or at their own expense would have an opportunity to buy into the PRS, the Police Retirement System. So the fiscal impact to the city in that case is zero or virtually zero, because it's the individual's responsibility. That has not passed in Jefferson City, and we know we only have till Friday for that to pass. That could be an impediment to the coming together of the two departments. So that if it were that they all had to be converted into PRS, it would be a big number. But since this legislation is moving through, we don't anticipate that being the case.
But if it doesn't go through?
If it doesn't go through, we're going to sit down and re-explore options to see what we can do. Then there are a couple of options that we will explore. But that is a big hurdle, an obstacle that we have to overcome before we can truly bring the two departments together.
Oh, I think, Chief, he's waving at us because the camera's flashing. He wants us to wait a minute. He wants us to wait.
Is this a TV timeout?
He wants, we got a timeout while he changes the tape.
Timeout.
And I'll
Enough time for him to change the,
yeah. Antonio, you used all the tape.
Come on, Joe.
That's okay, they're putting a new one in for you, so we're good to go for another hour or two.
Joe's.
can't go that long. There's a 1 o'clock meeting in this room. Okay, we're back. Okay, so anyway, just back on that same line, Chief. So, I mean, is it the other options, can you fill us in? And again, the only reason I'm asking, if you'd rather fill them in with me later personally, that's fine.
Yep.
But I just like, they're asking.
And it is, and I actually attended roll call out at the airport last week 2 separate times to talk to the officers to try and answer some of the questions that they have. It's a legal question that'll have to be answered. We're working with the city councilor on that. So I think until we get a clear direction, I think it would just further add to the uncertainty that's out there to make a statement. But we're aware of it, we're working on it, but I'm hopeful this legislation will get some traction over the next 3 days. It's an amendment to a bill, so I hope the bill moves.
Anyway, okay, thanks, Chief, and thanks for everything.
Thank you.
Alderman Carter.
Thanks. I only have one question, and you probably already answered this, but there's a section in here for professional services. I think it was $825,000. What services would that cover, or does that cover?
Do you have an account number? Just so we can
hold on, I lost it. Let me see. Professional services, 5,659,000 on page 231.
There is one specifically very large item in there, about 400,000, which is a upgrade to our PeopleSoft system. That has, we put the system in 2008, and we are now required to do an upgrade to keep the system.
To keep it going?
Keep it going, yes.
What's the name of the system again?
PeopleSoft.
PeopleSoft.
It's the system that we use to track attendance, to help generate payroll, to keep track of benefits. So it's our HR project.
Okay. And I'm not sure if anybody else asked this either because I stepped out, but have we seen any cost savings yet in terms of merging the city? I mean, with bringing local control?
And this is the conversation that anticipation of local control, in last year's budget, we baked in a lot of those savings. So as I started in my earlier comments, perhaps we even baked in too much savings because of the paper processes in the city versus our electronic processes learning the city. So is there a direct benefit this year from local control? No, it's because we anticipated it last year, and that's why this budget is relatively flat. I think I said a 3.4% increase over last year's budget. Last year's budget had the savings already anticipated in it.
Okay, thanks.
That complete you? Yes, sir. I'll be Alderman Williams, and you had another quick question.
Just a few real quickly. I know someone had mentioned earlier about the excise division and having a police officer with their staff, and this is my third time being on Ways and Means, and we've been trying to help that particular department out because they're in dire need of help. I know they have a lot of problems when it comes to liquor licenses in nightclubs and so on and so forth. But what would be the hours of that police? Will that police work evenings and weekends? Pretty much when the problem does occur at these places if they're illegally selling liquor. So will that police be working on the evening shift, or will they be really just working a 9 to 5 like the regular City Hall employees? And my second question is twofold. In speaking of the park rangers, and Alderman French had brought that up, and I know it is a problem in Fairground. That is a large park, and he does need a lot of help over there. And I have a problem similar to him in other city parks, mainly Ivan Perry Park, formerly Visitation Park, located on Clemens and Belt. And the problem that occurs over there frequently is that they bring their vehicles onto the park grounds. And, I've called the police several times, and the police, they do respond when they're really not busy, but that seems to be a problem that we're having for whatever reason And a couple of guys have called me and said, well, Frank, we know you called the police on us. I said, well, yeah, I did, because you have no business parking your vehicle on the grassy part of the park area. You won't do it in Forest Park, and I'm sure you have other parks you wouldn't do it in. So will that particular marshal or police officer, whoever it may be, or parks rangers, I should say, come patrol through and just check other city parks where, problems have occurred? Bear Brother, visitation, those type of things.
And currently, the patrol plan that they have does take the ranger that has the north side into all of those parks. What I'd encourage is, now that we know Ivory Perry and Barrett Brothers Park are issues, that we'll add them and ask them to pay additional attention to them. What I heard Alderman French ask was specific attention to Fairgrounds and O'Fallon. Right. I think we always have to be careful that Fairground and O'Fallon, and then Barrett Brothers, and then Ivory Perry, and then Carondelet, and then. So we just have to be as smart as we can with our resources. So we'll add those to our list. Can I ask a question about Ivory Perry Park? Sure. Is there a way to change the design of the park, basically spend one-time money to keep vehicles from being allowed to get into the park, and that kind of takes away that enforcement issue for us, kind of changed by environmental design?
Yeah, we have a little small parking lot on the Ivory Perry Park, and most of the people are pretty mindful when they park on it if they're playing basketball or going out with their kids, what have you. But in coming up from the eastern end of the park, Cabney is kind of wide open, so they come down Union and they turn up Cabney and they come west on Cabney, which is the 5400 block of Cabney, and then they just jump the curb and just drive into the park. That's mainly how they get on the grassy area of the park. So I guess we can kind of look at that and see, funding's tight, as maybe we can do a fence or something like that to kind of, on that northern end of the park, to kind of keep them out of there and maybe put a gate though. But that's the problem. Right. That we've been having.
And we'll add those just as we've looked at other parks. To answer your question about the excise commissioner, I see that role is working a variety of times when they're needed. Really, the late night economies, whether it's in the Central West End, downtown, Soulard, North St. Louis, going out when the bars are having their issues, but also focusing on the corner stores that are the neighborhood and nuisance. So a couple days a week during the day, a couple days a week in the evening, going where the problems are. That's really what from an enforcement perspective, where I see that excise office could expand a little bit into having that flexibility to do both. That's what I see this officer doing.
Okay. Thank you, Chief. Appreciate it.
Okay. Alderman Carter, you had one follow-up?
Yeah. And this isn't budget related, but I guess it kind of is in a sense. In terms of the nuisance process and helping our nuisance officers, our problem property officers, with more resources, is there a plan for that? Because a majority of my problems in my ward are dealing with nuisance issues, and my officer is great, but it's only one guy and he's limited. So, that would be a huge help, and I don't know if you were looking into trying to give them some assistance in terms of more staff to focus on that, or just, other resources.
What we're trying to do is make the nuisance property, educate the broader base of the officer population about the process and how to engage in the process. We're set at 1,251 officers, which is really our patrol plan, plus your nuisance officer, plus problem properties people, plus neighborhood ownership, plus a couple of other things. So tasking other officers from their patrol activities into problem properties and nuisances is probably not a good solution right now. But what we can do is educate the base population of the officers, so when they do see behaviors, they know how to get into the nuisance process or the steps they have to take and make it a little bit easier. So maybe assist that officer that you have. I do like the idea of having one or two single points of contact for that in a neighborhood, and that way you can prioritize, work with the city councilors, move those through. So I'm a strong believer and a strong supporter. If resources weren't an issue, I would certainly think that's somewhere we could invest. But balancing that against Sam Moore's request for more visibility and more officers, it becomes a challenge. But it's a priority, just like his is a priority, and just like our parks are important.
One more question: Do we handle nuisance properties, I guess, the same way that other cities with the same population do as well? Like, do they have to have multiple phone calls to 911 or can it just be something by sight or something that's known?
all I can say is that I have never had John McLaughlin, who is probably the
great,
best
yeah.
and the expert at this, come to me and said, hey, it would be easier if we had this change or that change. So I can ask him that question to see how he thinks we compare to other cities. But the impression that I have is that we're maybe leading in this area and not necessarily trailing.
Right. Well, this is my last comment. I'm sorry, and I can only speak for my ward, but I know that, like, let's say on a certain block, I may have a lot of vacant homes, but then I may have one house that's a major drug house for that specific area, and so you don't have a lot of people on the block that are called because it's a majority vacant homes. So how would I then get that home to be on in the nuisance process, and that's the problem that we are coming to see, is that in some cases, most of the residents I know in my ward that are in these crime-filled areas, they have lost hope in us and in you guys, and so they aren't calling the police. They just expect something to be done, and so they figure that if they share pertinent information to me, that something will get done, and I'll share it. But that just goes on saying. So I don't know. I just wanted to see, in that type of case, what will be done.
Right now, you're right. The trigger is the number of calls for service. But there are also tools that the problem properties officers have about Project 87 inspections and code violations and things like that. And maybe a stronger partnership with the building division to pull the trigger on those more quickly may have more outcome. And so Colonel Gray and Rich Gray and I can talk about that to see if we can, I know he's thinking about some new strategies around the NSOs and maybe incorporating the NSOs into that problem to be an early warning system, if you will, to be able to pull the trigger on some of those more quickly might be a good thought. I don't want to steal your thunder, but I think that's where you're headed.
That's satisfying. Did you have something else, Alderman Williamson?
Real quick, and this is my last comment, as the chairman said, if not, he's going to throw me off the committee, so this is it. No, I just want to commend you and your staff, and Ronnie Robinson, along with Demetrius Johnson and their foundation, Katia Waheed, and also Joe Yancey. I've attended some of those sessions that we've had over at the West End Center and dealing with a lot of folks in our neighborhood and throughout the city. It's just not the 26th Ward, but these people come from everywhere. And it's a way to really break the barrier between the police department and some of the people that have been victim of crimes or had loved ones victim of crimes. And going into those meetings has been very, very helpful to a lot of those residents in the city of St. Louis. And I know we've had some meetings when there was a lot of griping and raising a lot of sand, and everybody blew off a lot of steam, which was great. You got to do that. And then after that, the other sessions of breaking off and talking to the police and talking to a lot of the counselors have been very helpful in working with them and giving them an avenue to have some trust in the police department. Not only that, sharing information with them that they have to be more involved with their families and also in reporting crime, because that's the only way we can abate the crime is working together. So I appreciate your staff, Ronnie Robinson, and the others for really doing that, and it's been very helpful with our residents. Thank you.
Thank you.
Alderman Moore, you had one other question.
Yes. Chief, are you using drones?
We are not. We are not using any unmanned aerial platforms at all.
Is that something you like to do?
I think as we look around law enforcement around the country, as departments are trying to work smarter, to be more efficient, more effective, there are certainly some departments that are moving into that space. Dallas, it seems to be kind of in the southwest a little bit more, a couple of bigger departments. So it certainly has something that we can look at in the future. I know that there is a lot of concern and a lot of skepticism and a lot of ACLU issues around the use of drones. So it'll take further conversation, but it certainly is something in the future that I think law enforcement as a profession is moving towards.
I set aside for my community for cameras about $200,000. And we were talking about it, and you said that you had some cameras that we could get at a cheaper rate
what I said, we had specs for cameras that in the future, if you wanted to tie into our real-time intelligence center, if we do get funding for the real-time intelligence center, then we'll provide kind of the infrastructure, the backbone for cameras to be wired in together. So really, it's, in a nutshell, IP cameras, Internet Protocol cameras that can be connected through wireless or fiber to some monitoring station, pan-tilt zoom, some level of optics. Not a camera by specific, but just kind of the specs of a nice camera that will have a lifespan and some durability.
Wouldn't that help you with crime if we had a universal type of camera system that was monitored by, you know, your organization, your department, instead of French got cameras, Carter wants cameras, I pay for cameras and don't have them, but look like it would be a very good tool and instrumental in helping solve crime in the communities.
Like everything else, there's not a clear path for cameras. Rick Rosenfeld from the University of Missouri at UMSL did a study of cameras and found that while in the initial phase, as the cameras were new and people were talking about them, there was a drop or a reduction. He also saw some displacement because of the cameras, meaning just going around the corner where the camera can't see you. So the audience is, the jury's still out. But what I do believe is that when crimes do occur, so the deterrent value is what we're talking about there, uncertain about the deterrent value, but cameras can help provide good investigative tools after a crime has occurred. So at some point, and probably not this committee, but another committee, I'd like to make a presentation of what I see the Real-Time Intelligence Center kind of growing into. Then that's that $5.9 million that are in the GO bond. Timeline for us, if the bonds do go in November, we're probably 12 to 18 months away from an implementation of that, but I think it's a great investigative tool. And police departments like Charlotte and Mecklenburg are really using their real-time intelligence centers, and cameras are a piece of it, a fraction, but there are a lot of good things that'll come out of it. So cameras can have some value investigatively as a deterrent. I'll tell you, we're talking about anecdotes earlier, I'll tell you anecdotally, I had when I was a captain of the 7th District, and you may remember this, at Natural Bridge and Union on the Schnucks parking lot, a double homicide under a video camera. So the video camera itself there was not a deterrent, but there is some value in investigative purposes if they're the right cameras, have the right resolution, provide some product that is actionable, if that makes sense.
Cameras would be a great hotspot tool, and then we could put the police officers on the street. And
I will tell you, the cameras are just a piece of it. Then there's the connectivity, there's the maintenance of the cameras, there's the monitoring, there's a variety of things. So when people talk about cameras, we really, and we're working on it too, we're working on creating kind of a model or a standard we'd like to see. The cameras by themselves, but there's got to be budgeted for sustainability. There's got to be connectivity, and whether you can get to the city's fiber network or we have to do it wirelessly, there has to be, just like our guns, I talked about a 10-year replacement strategy, there has to be a replacement strategy for the cameras because they do have a life cycle, life expectancy, 5 years, 7 years, maybe 10 years. So all of those things have to go into it. So $200,000 is a great initial investment, but year over year there's going to have to be something put into the sustainability of that, or it just kind of will wither on the vine a little bit.
right now, I'm just prejudiced with my ward this way. If I had more money, I would put it, but eventually that's going to dissolve and evaporate into the general revenue fund if I don't spend it. So
And
I was kind of waiting on you, but since
what I don't want to do is push out a solution that we're not ready for yet. And so that's why I think this step towards the Real-Time Intelligence Center will actually make the city ready to be able to accept cameras. Chicago has a pretty good model. Chicago has public and private cameras. So Chicago's taken, let's say Chicago has about 22,000 cameras. 7,000 are owned by the city or government entities. The rest of them are owned by private entities, and they all kind of come together. And so by that I would mean, you know, we would have access to Metro's cameras, we'd have access to MoDOT's cameras, we'd have access to, let's just say BJC wanted to cooperate, BJC's cameras. Anybody that had cameras, we'd have the ability to aggregate or federate into this real-time intelligence center. What that does is it leverages our city dollars, and so we're not having to pay for 22,000 cameras, we're paying for some portion of it, but then we can focus on the connectivity, the technology, all of those things. So what we're trying to do is get our arms around this big comprehensive thing. Some cities are ahead of us, some cities are behind us. It's just, we just in the last, since I took over, have made it a priority and are trying to make it a reality.
Is there a camera in that car that you guys place just parked?
The only vehicle that we parked was the nuisance abatement vehicle, and that's the one that had an electrical fire and burned. We're in the process of, that's that big armored car. We're in the process of trying to get another armored car, or two actually, donated to us so we can have those nuisance abatement vehicles. There are cameras in that, but that electrical fire really rendered that.
The patrol car. People think that there's cameras in that patrol car, and the crime seems to diminish in that area. Since we can't afford cameras, it might be good to put some dummy cameras out so they never know. I'm sure people don't. You ever seen caught on camera on television?
The only, and people talk about dummy cameras a little bit, and so from my perspective, if we're going to do a camera system, I want to do a camera system. I don't want people to think that the cameras are there and they're not really there, because if something were to happen and the people go, well, you caught the guy that robbed me or shot me or whatever, and we don't have a real camera, I think that's a little disingenuous.
Who knows?
You want to respond on?
Yeah. So Sam, so they put a dummy camera in a shell car, and it was supposed to be like looking at this house. Long story short, they burned up the car in my ward.
They burned the car?
The police car burned it up.
That one wasn't an electrical fire.
That
one was arson.
So no, the dummy cameras don't work.
Those were dummies.
Thank you.
Okay.
Okay. Did you have additional
I did.
questions? If I could just make a statement. You know, as a chair, you know, I've always supported committee members receiving the information that they request in the manners that they do. I can say with a little pride that I'm the longest running alderman in the room right now. And so it has just been my experience when I first came here, the chairs of committees who really ruled committees more so in those days, always supported all the people receiving the information that they requested in the forms that they requested. Now, of course, we didn't have computers back then in 1989 when I first came in, so everything was hard copy. So I don't want you to think I was being unfair to anyone. I just support us getting the information that we seek. I also support all the people having the opportunity to ask the questions they seek and get the information that they're looking for. Typically, we're usually pretty polite with one another, and when one of us begins to go long, we ask them to give other people the opportunity to speak, which Alderman French did so that others could get their information in. It was my hope that we would be out of here by noon, but if Alderman French has a few more questions, we'll continue, however long you go.
I appreciate it.
With that, I just want you to know I'm fine with that. I do realize other alder people have meetings to get to. So if you have to get up and get out of here, that's fine. I just want to point that out, and we do have a few others here, but none of you all have asked to have any questions. So
If Alderwoman Flowers had a question, I would
Did you have a question, Alderwoman Flowers? So if we could, I'd like to go to her and then come back to you. I just wanted to make sure that we were clear on that point. And I do appreciate you acquiescing to the request as well.
And I always want to share everything we have. We're just a little more, we use electronics instead of handing paper copies. It's just our culture.
Well, you know, we had to fight for almost 8 years just to get the first laptops here at the board. So we're not as technologically savvy as your office.
And I'm glad we came to a resolution before we left, so thank you.
We do a lot of paper around here. Yes, Alderman Flowers.
Thank you. I'm sorry, Alderman French was addressing you about the park rangers. When I went out the room, I got a call from Captain Kuntz, so he's doing some things for me. And we have North Riverfront Park up near Riverview and 270. It's quite a far distance from North Patrol. And as my understanding, the park rangers are now under the police department. And before, the park rangers were closing a gate that we had. And since the local control change, it hasn't been getting closed as often. Now, I know that the rangers have a lot of duties all across the board. And North Riverfront Park is just one of those parks that's, it's in between the line of Riverview, Illinois county border, and our 911 calls goes everywhere. So,
Can I just
Go
answer your
Sure.
question? I think we've resolved that.
Okay.
Hopefully, Eric Armstead just went to the meeting Monday. And the part of the problem was our night watch went down to 2. and we just couldn't cover the distance anymore. If you do the math, it was 25,000 miles a year we were traveling to lock and unlock a gate and go to the park. It's a 17-mile one-way trip to Riverfront Park from Forest Park. So we're locking the gate every night now. The park rangers are locking that, okay? I've received permission to give 2 keys to Patty and David. They have a key, and then the 6th district's going to be responsible for opening the gate. And I am aware the park closes half hour after sunset and you know, different than the other parks. So we are paying attention to the matter, and I wanted to go to the meeting. I had other engagements, but it's not out of my mind, and I'm on top of that one. So I hope that you'll see that it's been resolved.
And I do know of the keys being given to the residents. The thing that probably needs to happen, which me and Officer Armstead spoke yesterday, is maybe a policy or procedure needs to be put in place, because as a resident closing a gate, if there are people in the park after curfew, you know.
That should never be an issue, because the park rangers will be closing the park.
Okay, so park rangers are closing.
Yes.
So what is the purpose of the residents having
Just,
keys?
I asked the Commissioner of Parks, Dan Skillman, if it would be possible to obtain a couple keys in case something occurred where the gates weren't open, or if they saw something, and that was just a fail-safe for us. But the 6th District will be opening the gates in the morning.
Thank you. I just wanted to be on record for that so they can see this
Yes.
now. Thank you very much.
Thank you.
Problem solved.
Great. Now we're back to
Yeah, I just
Alderman
have
French.
one last line of questioning. So one of the risks that we adopted when we accepted local control of the police department is to now cover 100% of the cost of judgments against the police department. You know, just in the last few weeks, we've seen judgments. I think there was a $7.5 million judgment, a harassment claim. We've had that smaller judgment dealing with the wrongful arrests, which is a whole nother issue. And I think there was a $620,000 lawsuit recently also regarding discrimination. What efforts are underway in the police department to deal with some of these risks that the city taxpayers are taking?
And I think I think risk is absolutely the right word for that. So let's kind of take those individually, if we can, for just a second. The wrongful arrest one is the one that is anytime anybody is put in jail incorrectly, I'm concerned about it. So we've talked about, with this Public Safety Committee and with the Board of Aldermen, about changing our arrest policies and the steps that we put in place. So now at each booking point, at each of the area stations, there's what we call a Morpho ID, a quick ID, a rapid ID. So an individual will take their finger and put on this, and within 30 seconds, we'll get a confirmation of who they are. That doesn't replace the 10-set fingerprint that you do at the Justice Center to verify, but there's a high degree of accuracy with that. So every individual...
That's a new thing now?
It was put in place early April, maybe late March. Okay. So that's something that we've put in place recently to make sure that we try and minimize that exposure. There's always the chance that people have lied along the way through their criminal history and the record is wrong, but this is the first line that we have now to identify them or with some degree of certainty. Then they're booked based on that information that we receive from that rapid ID, which takes less than 30 seconds. And then when they go to the Justice Center, they still submit a 10 fingerprints, and it still goes to the state, and we still have technicians that do it the old-fashioned way. So there's an additional safety that's put in there to try and keep people from being wrongfully arrested. We've also put in a request to purchase, and I believe from our foundation, some number of those devices that we can deploy out in the field. So now officers do it at the arrest point, at the booking point, and now if there's a question out in the field, maybe one supervisor, one sergeant per district will have that device in their car and be able to respond to a scene and get some clarity on it. So we're really trying to push that technology, whenever we can, technology solutions out to make the officer's job easier, but to make sure that we get it right. So that's the step for that wrongful arrest piece. The two settlements that you talked about, the $7.5 million, there was actually an EEO investigation done on that, and it was found that the individual was not harassed sexually in the workplace, but there was a retaliation claim. That retaliation claim is what resulted in the $7.5 million. I'm not an attorney, but kind of in the way that I understand it. We're currently, and from what I understand, the law department is reviewing an appeal of that case for a variety of reasons. What we've done in the department is I formed a committee to review our entire policies around discrimination, sexual harassment, retaliation, and tomorrow they're going to present a report to me about any changes they recommend in those policies to make sure that this type of situation doesn't occur again. And then for the $650,000, $620,000 settlement that you talked about, that one, simply our policies and procedures were followed, but there was conversation that happened between individuals, if the way I understand the case, again, this happened before that I was there, put the department in a vulnerable situation. We're reviewing that to make sure our transfer policies, our interview policies, our job posting policies are adequate, and then we're going to address training issues around that. So, hey, judgments are a significant concern for me. As we talked about money and budgets today, I think the department is funded adequately for what we have right now. I would always like to see an expansion. Whoever asked the question, whichever alderman asked the question about workers' comp, is absolutely right. That's an area that we wanted to make sure we were focused on. In 10 years, we've dropped that $3 million. Doesn't mean that next week something tragic doesn't happen to an officer and that number goes up, but in the areas that we're able to control or mitigate those problems, seat belts, mandatory vest policy, larger vehicles, we've tried to do that. I think we have to do the same thing about judgments and settlements. You know, if you follow the paper, Anheuser-Busch right now is involved in an equal pay discrimination suit. I think any agency, any department, any government is always exposed to that. I think we just have to continually review our policies based on experience, not only in our department, but in businesses around the community, make sure we have the best practices and minimize that, mitigate those exposures.
So a budget question, if that $7.5 million settlement sticks, where does that come out of? I know we have that 1119 fund for police judgments and 1719 fund for the Public Facilities Protection Corporation, but those together don't total $7.5 million.
And that's, yes, and that's a question that I think that the budget director, along with the leadership of the city and the department, have to have a conversation about. Because it's under appeal, I don't think anybody's programmed the money in, but I think that's a real conversation that has to happen. Even under the state model, the state was only responsible for the first $1 million? Up to $1 million annually.
Total for the whole year?
So even under the state model, the city would have been responsible in this case for up $6.5 million or more, and so we would have had to have this conversation again. This did happen under state control. The state will have some portion of it, but as Dave said, the state caps out at $1 million a year. So if they've already spent, I'm making up a number, $800,000, they've only got $200,000 to contribute towards that.
Okay. That's all, Mr. Chairman. Thank you.
Okay. Are there any other questions of members of the committee? If not, we thank you for your information and your testimony. That completes our meeting today. We will resume tomorrow at 9 o'clock. With that, our meeting is adjourned.